Hi, everybody. We're just going to give it a few minutes. I see a few more people are joining, and we'll start officially. If I can ask you to mute, if you're not muted, please. I see several people who are not muted. Can the co-hosts, Janet and Rehab, can you just manage the muting, please, for anyone who's not speaking? Thanks. So we'll start in about 2 or so minutes. Welcome, everybody.
Mm-hmm. Mm. Mm.
Because I had not activated it.
Okay, I think we'll go ahead and get started as we wait for others to join. Thank you, everyone. My name is Ori Okolo, and I'm one of the members of the COVID-19 ICT task force, and I'll be your moderator for the day. What the goal for today is to, as part of our TRRs, we were tasked with the job of developing a framework for identifying and supporting local ICT solutions that can support the country in its efforts to both combat COVID and also the longer term effects. We have been going through a number of submissions. Our chair is on here and she'll give you a bit of an update of what we've been up to so far. But really the goal today is to listen to some of the entrepreneurs and innovators we'll be showcasing. They'll be doing very short presentations, but feel free to ask the questions through chat and also to listen to some of the stakeholders we've been engaging with. In terms of just protocols, it's my first time moderating a webinar, so forgive me if I'm all over. Normally, I'm on webinars listening in with video off, but today I'm the host. So I hope I'm able to do a good job. Encourage, if you're not speaking, please be on mute. We will be recording today, so I hope there are no issues with that. And again, I've encouraged the entrepreneurs to participate in chat. So if you have any questions as they present, feel free to ask them in real time. I find that ends up being a lot more interactive and effective than waiting for a rushed Q&A at the end of the session. So with that, welcome. We have a great participation and good to see all the excitement around this. And I'll hand over to our chair, Mercy Wanjao, to do some welcome remarks and update, provide a short update on the progress that the committee has made so far. Over to you, Mercy.
Thank you very much, Ori. And,
Hi, guys.
And good afternoon to all the participants on this webinar. We are very delighted that you can join us to allow us an opportunity to account on the activities, the actions, the progresses that we have made in this committee, and also to allow the innovators who have come in through our process to showcase what they have. Joining us this afternoon, we have PS Jerome on behalf of CS Moshero, and is the Deputy High Commissioner from the United Kingdom, and we're very delighted that you can join us. So I will take you through a short presentation on the steps that we have taken so far, and I'd like to request for the presentation to be uploaded. So this is some slides that I'd like to take you through, just touching on the various TOR. Next slide. The mandate of the advisory committee was basically to coordinate ICT-specific responses to the effects of COVID-19 pandemic and beyond. As we all are now aware, there have been previous pandemics in the history of mankind. And the last one in 1918, the Spanish flu, took about 2 or 3 years. Because of limitations of technology and science, some of the cures and the remedies took a long while in discovering. But this is happening at a time when we have technology breakthroughs and medicine as well. And our hope and our trust is that a vaccine will be soon incoming, and that also technology breakthroughs can be put to the service of humanity at this very crucial time. We had a TOR of covering a couple of things which I will take you through. Ultimately, we are required to advise the Cabinet Secretary, the Ministry of ICT, Innovation and Youth Affairs as appropriate, the view being that the proposals would then be moved onwards to government, private sector, and civil society for these solutions to be deployed in order to enable service. Next slide. These are some of the actions taken under the various TOR. The first one, we were required to develop and implement a framework for identifying and supporting and scaling local ICT solutions. These solutions would then be utilized to support the country in its efforts to combat the pandemic. In response to this term of reference, we did a call for innovations, and we had 410 applications come in the first round. Out of this, 37 applications have been identified for potential support and scale up, and 25 are under evaluation stage, and presentations and demonstrations are ongoing. Because of the enthusiasm that we witnessed in the first call, we opened up a second call, which will close on 21st of August, and we wait to see the exciting other presentations that will come through in that one. On the second TOR, we were to cover the area of policy review and establish an enabling environment that will stimulate economic development through ICTs. By doing this, the term of reference anticipates that it will lead to an increase in digital employment, and this will support enterprises, workers, investments, and skill development. This is a very key TOR, particularly now when a lot of enterprises are downsizing and staff are losing jobs. Indeed, we have a growing youth population that hopes to leverage on the gig economy to be able to make a decent living. In this regard, we have looked at a couple of policy review considerations which we continue to address. One of them is the framework of digital learning in Kenya. We recognize that under the Education Act, digital learning or the e-classroom is not quite anticipated, and we are in discussions on how this can be enabled so that time spent working online would be recognized as education time as anticipated under the Education Act. The second arm of enabling the framework for digital learning is last mile internet connectivity, because while the Communications Authority of Kenya does engage in universal service initiatives, now the urgency is clear and the danger of exclusion is very apparent. So the need for the last mile connectivity that would allow for bringing of services critical like education, like health, down to the homesteads and to the households is very critical. Carrying on this item, of course, is the issue of affordable devices that would enable access to the internet for meaningful gain. A second item of we have picked as a contributor is the framework for commercialization of the TV white space. And basically what this means is that it would allow opening up of other spectrum bands that have previously not been utilized, and it would allow for these spectrum bands to be used for commercial purposes, to bring in more players, to provide more services. And this is a framework that is currently under consideration. And at the second showcase, we will be sharing some more on this. A third item is the issue of licensing of courier service providers to support the gig economy. While we did have the postal courier category within the ICT sector framework, we do recognize that now a lot of purchasing is happening online, or it is happening in spaces where delivery is being made by a third party. So we believe that a relook at the method and the framework for licensing of courier service providers is key, so that it is comprehensive enough to embrace any individual that does courier services. What do I mean by this? The traditional courier anticipated is the vehicle that carries packets and delivers. But now we have an emergence of border riders, for example, who deliver items from one point to another, and the need to safeguard those items to provide the same service level agreements as would be afforded in the more traditional or conventional method of courier. And this is something that we are also going to be giving recommendations to. Then last, but by no means the least, is recognizing that with the COVID-19 ICT technology innovations, data sets will begin to assume prominence, whether it is data sets for health, insurance, education, or even other business models. This working group has developed draft guidance notes on access to data by innovators, so that these guidance notes would help access to data from government and other sources in order to power the innovations that we will be viewing in a short while. Next slide. The next TOR was on innovative solutions, where we are looking at establishing an enabling environment to stimulate economic development through ICTs and increase digital employment by supporting enterprises, workers, investments, and skill development. In response to this, we have identified innovative solutions which we would like to recommend for adoption by national and county governments. we have come across some very interesting, very thought-provocative solutions. Some of them are listed below, like Voices of Bungoma, piloting of ICT solutions in the health sector in Nairobi County. And indeed, we have received a lot of contact tracing innovation solutions, automatic hand washers, which allow for hand wash without any contact on the gadget, and even compact and portable ventilators. We have evaluated a lot of these innovations and forwarded them as appropriate, some to the Ministry of Education, others to Health, others to Transport, and we will be hearing a lot more detail on this. The next element of the TOR was stakeholder engagement, where as part of our work, we will be required to coordinate with innovators, academia, the private sector, and well-wishers on utilization of these solutions that address the effects of the pandemic and beyond. Let me take the opportunity to thank the participants this afternoon, because we have had a lot of positive uptake on this particular one, and this has enabled easy discharge by holding discussions with stakeholders in 3 categories. Under well-wishers, we had stakeholders like TESPOC, who undertook to ease the education platform with the children learning online, Andy, Vilgro, UK Aid, Innovation Norway, and Pangia. We also have had discussions with ICT solution providers, as indicated, and have received a lot of policy support in this committee. Some of the areas that have sparked the stakeholder engagement, as you will see from the policy support received, is education with KICD, that's the Institute of Curriculum Development, KIPRA for Public Policy Analysis, Kenya is the Innovation Agency, KIPI for Intellectual Property, and Kekobo for Copyright, and Strathmore University. And we continue to encourage other stakeholders who would want to engage with us to come forward, because it's getting better as we engage, because this enables us to connect the dots and to come out with even more value-added proposals going forward. Another of our TORs was engagement with experts, where this committee has been required to examine the effects and the impact of COVID-19 on the lives and socio-economic activity of Kenyans, and advise on key ICT initiatives to respond to the pandemic, to mitigate the effects of pandemics on individual livelihoods, communities, and the economy. This is what we call a living TOR, because as the pandemic continues, the effects of the pandemic are felt. And because of our philosophical orientation of trying to handle the pandemic as is, we are also committed to survive and thrive going forward. Then this kind of a TOR is one that we really look to be able to give us solutions and dynamics that can push us into the future, that would enable this crisis to be turned into an opportunity, not only for individuals, but also for communities and for the economy as we go forward. To be able to engage on this TOR, we co-opted research experts from the Kenya Institute of Public Policy and Research Analysis, and they have worked beside us to inform us with the emerging trends, to inform us on the kind of data and statistics that are coming out, and we will soon be releasing our first report on the outcome of e-learning in this pandemic period. The next TOR covered the aspect of intellectual property rights and innovation, and this committee will be making proposals on appropriate policy and regulatory interventions that include IPR and the implementation of sandboxing to fast-track the adoption of innovations. Once more, we are undertaking this TOR, working alongside experts. We do have legal experts from the Kenya Law Reform, identifying the legal aspects that would need to be modified. We also do have the ICTA, the ICT authority, alongside KIPI and Kekobo, because some innovations come at different stages, and some of them will need to be incubated or sandboxed so that they can be monitored and guided in order to fast track the adoption of that innovation and the scaling up later on. These are the updates that we have on actions under the specific TOR. Next slide. And arising out of the exchanges and the discussions that we have had, which have been very robust, very insightful, we will move on to advise on the role of technology in delivery on the value to humanity, including the role of ICTs in exporting labor and innovations, stimulating and growing all sectors of the economy post-COVID. In response to this TOR, this is why you will find on this webinar today, we do have representation from global bodies coming in to listen in, because Kenya, having taken the space of ICT leadership, for which it is humbled to continue to undertake, we believe that some of the solutions that will come out of these exchanges are solutions that will be dedicated for use by mankind in different jurisdictions, something that we will be very happy to support in order to manage the pandemic and to assure that livelihoods and productivity and growth of economies can be able to progress as best as possible in the circumstances. So as we do this, we continue to prepare and submit reports back to the ministry that set up this working group. We have prepared and submitted monthly reports, and we also have provided information on potential innovations for funding and the draft guidance notes for data access. Next slide. So with that, I move into the main crux of this webinar today, which is to showcase and listen to the innovations identified for consideration. And we do have the innovators who will be taking us through their presentations. And mine will be to just highlight who they are in the next slide, to be able to showcase the proposed innovations identified for support and scaling up. In the health sector, we have 9 innovations, and you can see on the slide the various logos, all looking very nice and bright. Afya Record, My Health, Imarisha Africa, My Dawa, The Daktari, Medixas, Afya Kit. In the education sector, next slide, we have 6 proposed innovations: Dawati, Kitabu, Mshule, online revision platform, a digital learning platform, and EduVoard. And we'll be hearing from the innovators, giving us the details of what the value proposition is in each and every of these innovations that we have identified. On the next slide is the proposed innovations identified to support and scaling up in the agriculture sector, where we have lined up 3 innovations for today's webinar, starting with Zalisha, then digital poultry agripreneurship, and Acre Africa, and we will be hearing a bit more on this. So members, you can see that this kind of innovations and solutions are applicable in Kenya and beyond. And we trust that this will be a very engaging time for us to stimulate thoughts and ideas on how best we can leverage on these fantastic ideas. On the next slide are the 4 innovations that we have proposed for the transport sector, where we have M-Safari, eBima, Safari Express, and the Smart Traffic Corp. A situation that would definitely be useful even today with some of the kind of traffic jams we experience, and even beyond. Moving on, in the economy sector, we have lined up 9 innovations: Startup Suite, Microsoft Artificial Intelligence and IoT Solutions. We also have another one, M-Kula, and Wowzy, Errands Guy, nipejob.com, the Intelligent Digital Workforce Platform, Mulika Uhalifu, an anti-corruption proposal, and Ajiri for Work. And on this one, we do recognize that the internet economy presents a new opportunity, particularly for the youth, that this would present situations and platforms for linking up a job opportunity with the relevant skills and to make it happen for the person to exercise their skills and make a living out of it. This is the kind of win-win kind of situation that we are hoping to achieve. Additional considerations that we have made in making the policy review is that the goal and the objective of these terms of reference that the committee continues to handle is to try and make the experience out of the pandemic lighter. That much as the pandemic is a hit, it is a big disruption. We are trying to leverage on it to make the best of the situation. We are also trying to look at our regulatory frameworks to see how best they can be stretched to integrate the digital aspect of things, because unless it happens at the enabling framework, then it remains as a gap, which means that it becomes a disconnect. Right now, Kenya has embraced the digital economy blueprint, which is aiming towards digital transformation. And what a time as this in a pandemic that this would be used as a leverage to leapfrog into the digital economy because of the transformation that has happened. Because of this, we find that the enabling policies will be very, very key for education. And as we look forward to children going back to school in January, we recognize that it might not be going back to school in the way that it was in the past. School is likely to resume on social distancing principles. It is likely to be heavily reliant on the ICT platform, and this is why we continue with the commitment of the work that we are undertaking as described in the various other policies that I have just mentioned. And these are documents that will be shared out for consultation so that when we finally adopt them, we adopt them as the best at the time at which they are ready for uptake and utilization. So in terms of supporting and scaling up of innovations at the next slide, we would like to provide linkages to potential innovation seeking access to government agencies. This is one of the asks that came through for quite a number of the innovations, and we continue to connect potential innovations seeking incubation and funding to innovation hubs and accelerators. As we carry on with the second round for the call for innovations, we have recognized that innovators are coming in at different stages of maturity. And while some require access to a government agency, others require funding. And we have provided a spectrum of 3 layers. One of them is at the grant giving level. The second one is the low cost capital. And the third one is where equity participation would be involved. And a mix of this, we believe, will really go forward in triggering the upscaling and of these innovations that we have. And I believe that from listening to this showcase today, we'll be able to provide feedback and advice and give advice to upcoming potential innovators. So with those few remarks, I'd like to pause there and go back to Ori, who will be taking us through this, and look forward to listening to the various innovators. Thank you.
Thank you, Mercy. And just to clarify, I think on her slides, there's some innovators that were listed, but not everyone is presenting today. There should be several opportunities provided over the next few weeks. With that, I'll quickly hand over to Robert with Vilgro, who'd like to share a few remarks. And then we will have the Deputy High Commissioner, Susie Kitchens, and then PS Jerome. Over to you, Robert.
Thank you, Ori, and it's a pleasure to have this opportunity to share a few words For my presentation, I'll just take us very briefly through a little bit of what we do as Vilgro and why we are privileged to be here for this webinar. My name is Robert Karanja. Just for those who don't know me, I'm a biomedical scientist by background, and I always like tell people that I was so sure that I was going to get the Nobel Prize for medicine, because I've never understood why some diseases like malaria still kill us. But it's only much later I realized it's not so much about the science. It's really more about the innovation. How do we translate the science to impact that we really need to address in order to solve things like malaria and many other diseases. And COVID-19 is one that, of course, is the topmost in terms of thinking when it comes to infectious diseases. And for everything, I always like to say, how can we look at it from a glass half full as opposed to half empty? So today I'll really just be talking about how can we leverage the fourth industrial revolution in order to build in terms of our health systems resilience. How do we create jobs? How do we create wealth? So just a little bit about Vilgro. We are an early stage business incubator and investor. I think Vilgro is probably one of the oldest, if not the oldest, social enterprise incubator in the world. Been around for 20 years with operations in India, the US, and in Southeast Asia, in Manila. But here in Kenya, we've been in operation since 2015. And we have a diverse core team with plenty of expertise in all the areas of innovation, entrepreneurship, the science, the business development support. And for those who never heard about Vilgro, I think what I usually try to say is that we do have a fairly interesting job. We don't try to own the space and to be known. We try to make sure that the entrepreneurs we work with are the ones that tend to receive the attention. Bempu is one such company from India that was recently named as one of the 25 best inventions on Time magazine. And I think the challenge is for you and me to see how can we have a Kenyan company also be named as one of the top 25 inventions in the world. So what have we been doing in East Africa? We've been working across Kenya, not just in Kenya, but also in Uganda, Tanzania, Ethiopia, across the East African community. And over these last 5 years, we've been able to incubate, it's coming up to more than 20 companies now that have been able to impact more than 1 million lives. And we do so, we know so because we actually work with them in terms of capturing the impact metrics. They've also generated more than 1 million in new revenues and been able to unlock, I think to date, it's around about $8.2 million in impact investment. And all of this is coming into Kenya's and East African economy and creating jobs. And of course, we really do want to create wealth. So just to talk briefly about COVID-19 and the challenge, what does it mean to innovators? And for us as a country, and as in fact, most of the region in Africa, we've taken two approaches to it. The first one is prevention. And here we talk about water and sanitation and hygiene. But we realize that not just for us in Kenya, but most of Africa, sub-Saharan Africa, we do have a huge challenge in terms of access to clean water. I believe when you look at the records, you realize it's only 25% of our population that actually has access to clean water. 35% that has access to even the sewage and all of this. So how do we then address the issue of prevention through cleaning water? There's a lot of opportunity right there for all sorts of innovation, just addressing access to clean water. Then of course, the lockdowns and the quarantines and self-isolation, social distancing. And of course, the key issue here is you ask yourself, how can we be able to do this? How do we also earn a living? And so there's a lot of work to be done in terms of, and it's been done actually, in terms of modeling, in terms of behavior change, in terms of trying to understand how do we reduce the level of transmission, wearing masks and things like that, that we were not doing not too long ago. And you need to get people to start picking up new ways of doing things and new ways of living. Then the second objective of dealing with the second strategy for dealing with COVID-19 is the test, trace, and treat. And this is where, as you know, especially those people who are coming in from outside of the country, they'll be tested, they'll be quarantined, then there'll be contact tracing, and then they'll be treating for even those whom we have been in touch with them. But now when you look at it from the, move up a few 10,000 feet or so, you realize that we have a health system that has been chronically underfunded. And so there's an aspect of fairly weak health systems that are lacking adequate human resource, equipment, and supplies. And then there's also the issue of access to PPEs, the health technologies that we need to combat COVID-19. There's a search for drugs. Until now, we're still using real-time PCR, extremely expensive. The kits for doing these tests are not readily available. And also the medical devices, the health technologies that nurses and doctors are using in the health setting. So we do need to have a lot of work in terms of understanding how do we strengthen our health system, not just by importing health technologies that have been designed for wealthy countries, but how can we actually innovate and come up with health technologies that are designed for a low resource setting, that can be able to work without breaking down, without letting us down when we really need them. And one of the other big things to highlight is the oxygen crisis. And I thank all the innovators we have in this country, in this region, because we've seen a lot of work being done in terms of developing local ventilators. But ventilators is just one piece. We also need to understand where's the oxygen going to come from to work with these ventilators. How do we get into medical oxygen production, tanks to deliver it to the health facilities, the whole ecosystem for oxygen, pulse oximeters, the tubes, the masks, for being able to serve the patient. And so there's a lot of work that we can be able to do, a lot of interesting areas of innovation that innovators, fourth industrial revolution, can be able to plug into. As Vilgro, we are therefore looking at 7 strategic technology areas for our COVID response. The first one, of course, is access to water. How can we have point of use water treatments? Then how can we also be able to have point of care diagnostics, preferably those that can actually be able to pick up on the antibodies, IgM for active infections, IgG for past infections. How can we have multiplex diagnostics? Why? Because COVID-19 is really just one of the many infectious diseases that we are coping with. Africa is actually only 17% of the global population, but we have 25% of the global disease burden. And so not just saying it's not COVID is not enough. If somebody's dying, we want to understand then what else could it be? How about looking at off-grid cold chain delivery solutions? We've been talking a lot about vaccines, but vaccines are protein in nature. Rolling it out is quite difficult, especially in remote areas. So understanding how does the supply chain work and how can we provide off-grid cold chain refrigeration or support. Medical devices, and it's good to note that PPEs are actually part of medical devices class 1 or class 2, depending. Access to oxygen, as I mentioned earlier. Then also understanding now, as the government is looking at how do we have healthcare, COVID care being taken at home. How can that be done through telemedicine? How can it be done through IoT? How can it be done using wearables and medical equipment that can be able to link you at home with the healthcare personnel in the health facilities? And I think the key thing to highlight is that for us in Kenya, we tend to talk of these things as if it's a vision 2030, whereas the reality is there's a lot that already is available. We actually have a lot of under-leveraged capacity. If you look on the left, at least my left, you can see when you the map for all the R&D, health R&D that's happening across the continent, and this is about 10 years ago. And just to let you know, Kenya is actually ranked only second to South Africa in sub-Saharan Africa. So we have a very strong life sciences R&D platform and ecosystem in this country that we should be able to leverage to answer these questions. And then the other thing to also point out is that we also have a fairly diversified economy with quite a bit of manufacturing happening. So even the ability to do hardware innovation, not just the digital, and being able to bring these two together, I think is one of the things that Kenya can actually really excel in. It goes without saying that we're not the only ones seeing this. And when you look at the numbers for the investment in startups that happened just last year, talking about $2.02 billion, with about a quarter of that, 564 million, coming into Kenya. And the question then would be, where is that money going? A lot of it, of course, to fintech, but also I believe as we look at COVID-19 and how it's disrupted our lives, we should be able to understand how can we leverage our strengths in IT, our strengths in life sciences, our strengths in having an industry manufacturing this, to be able to speak to the needs of this country and for the region. It's also good to highlight that this cannot be done just by innovators alone, but we also need to have a lot more coordination. For us in the innovation sector, we keep talking about the triple helix. How do we have government, academia, and private sector here being the innovators and the investors, being able to read off the same page so that there's predictability and there's an ability to co-create platforms, for example, for product design and validation. It's not easy to just go into a health facility and get access to doctors, to get access to patients. We also need to address the issue of procurement because one of the reasons that our health statistics are so low is not because the scientists have not done their job. It's really because of our broken market system. Our purchasing power is so much lower than what the big pharma and the big medical device companies tend to command in the developed countries. So they therefore neglect our countries. Africa as a region, I think we're about 2 to 3% of the global pharmaceutical market. We're about 2% of the global medical devices market. And that tells you straight away why you see our lifespan being so much lower than any other region in the world. So the only way to address it is to actually have more government procurement, then investment, industrialization, incentives, so that we can actually have a homegrown and an export-focused industry. We've had a lot of discussions in this ecosystem about how disadvantaged local innovators are compared to expatriate innovators or entrepreneurs that are coming to set up businesses in Kenya. We need to ask the questions, why? Why is this happening? What is it that needs to be done? And I think one of the things that needs to be done is to be able to enable investors to come to the table. I think a lot of the countries that have been doing what we are also doing, and they're doing fairly well, they actually make provisions for angel investors to be able to write off the losses they incur on even their pay-as-you-earn tax. And so small things like that can actually make a huge difference, because the one thing that I see as the biggest disadvantage for local entrepreneurs is the fact that we don't have the seed capital to start off. And for you to be able to talk to investors, they must be able to see some market traction. Where do you get the market traction when you can't have the capital? And how can you make it easier for investors to be able to actually provide funding for startups and creating jobs within the formal sector, not the informal sector only? And then lastly, as the agenda maker, the government is able to channel, and I'm glad Mercy just talked about this, all the partnerships that they're bringing on board, and basically setting the agenda to say, this is how, as a country, we're looking at COVID-19. This is these are the innovations that we are seeing. These are the ones that we are supporting, and that allows us to then be able to work in a much more cohesive manner, with each part of the triple helix being able to anticipate the needs and the actions of the other partner. I will stop there for now, and thank you so much for this opportunity to share a little bit about our work. We are also having a COVID-19 fund that we've set up, and we are currently, of course, looking for applications. So if you have anything around those 7 areas that we are targeting, please do reach out. We'll be able to share with you my contacts, and we look forward to partnering both with the ICT task force and with the innovators in this country. Thank you very much.
Thank you, Robert. If I can ask you to share your contacts on the chat so that everyone knows how to get in touch with you. And I'm aware we're running a bit behind schedule. Do we have the Deputy High Commissioner? I don't see her. Is Susie here? And then P.S. Jerome, you'll be next. If we could keep our remarks brief. I think everyone is excited to hear from the innovators. Thank you, Susie. Good to see you again, and over to you.
Thanks very much, Ori. It's great to be here. I hope you can see me and hear me okay, because I can't see myself doing this blind. Anyway, really, really appreciate the invitation to join this webinar. We're very pleased to see the development of the ICT COVID committee. I think you're destined to do great things. Also, great to follow Robert and to know that the PS is going to be speaking next. That shows government commitment to this agenda, and of course all those innovators who are going to do such important things as we go through this COVID process. So just a couple of things that I want to say as an international partner and friend of Kenya. Kenya's international appeal as a Silicon Savannah is really important. You have a reputation for bright, disruptive innovators and a can-do hustle culture. And I encourage you and urge you to shout that out loudly. Tech and innovation is a real calling card for Kenya internationally. And now at this time, as we're dealing with a pandemic, of course, we need disruptive thinkers and people who can blend technology with behavioral insights and the benefits of a wide ecosystem more than ever. And you really do have the skills here to make that happen. And today, of course, in this webinar, it's the tech bit that is most relevant. In such a fast changing world, technology affords us opportunities to do more as individuals and in collaboration with others. And it gives us the power to include, to reach, to inspire and to communicate, to educate and to change. So putting technology at the heart of the COVID response is really important. Not only can technology lift millions of people out of poverty, but it's also a driver for jobs and investment. This means a lot to us in the UK as well. If you're following media coverage of how coronavirus has hit the UK, it's hit us really hard. We've got problems with unemployment, we've got problems with people adapting jobs to the new reality. And our fast-growing digital tech sector, which employs more than 1.5 million people and generates about £7 billion in investment per year, higher than most other European countries, is absolutely central to our response as well. And going digital is no longer simply part of how we conduct our day-to-day activities, but also the bedrock of our economic growth. So working together, we hope that we can tackle some of these great social challenges of our time, as the ICT committee is pointing out around COVID solutions. It's not going to be easy. I've referenced, of course, already what's happening in my country. We genuinely share the pain and devastation that's brought about by COVID-19. I've seen my colleagues, my community here in Kenya, really ripped apart by the fear of this illness and the uncertainty about how we're going to handle it. My family got evacuated for a few months. We've still got 2/3 of our staff out of country. We've been really impressed actually with how the curve has been flattened here in Kenya, something that we weren't so quick to do in the UK, as we had a peak that was very early in the crisis. But that has enabled us to have confidence in how we can live with coronavirus. So we hope to be bringing colleagues and their families back to Kenya as soon as flights allow. But it's going to be hard and it's going to be long term. I think we can't pretend that we can wait until we're over coronavirus. It's not going to happen. So we need powerful and coordinated action to manage how we live in a world of pandemic reality. And to reduce the economic damage of this crisis, protecting jobs and businesses and supporting the stability of our economic and financial systems. We're walking the talk at the British High Commission here in Nairobi. We've done a huge amount of work over recent months to pivot our programmes so that we are taking into account the COVID realities, we're responding to the new challenges, and we're really bringing tech-enabled solutions into our work. Couple of things I'll just draw out, and then I'll mention some of the calls currently active. So our work across science, technology and innovation is coordinated with the government of Kenya through a high-level board, oversight board that's co-chaired by CS Mugawa and our High Commissioner. The board met in May to talk about the pivot to coronavirus, and we were joined then by the UK's Department for International Development's Chief Scientific Advisor, Charlotte Watts, who also happens to be an epidemiologist, so she's right at the centre of the British government's efforts to understand the disease. We've, over the last 5 years, about £165 million worth of research investment has come into Kenya through science partnerships. And that has focused on priorities determined by Kenya, so it includes health, food and nutrition, manufacturing and housing. And we're looking now at making sure that we're really building on that research so that we've got evidence-based data and evidence on which to base our programmes going forward so that we can be confident in their efficacy. Obviously, a lot of the work around coronavirus requires novel stuff. We haven't dealt with something quite like this before, but we're using the evidence we've got so that we can be confident that we can have a positive impact. So that's our work around science and research. The DFID Wellcome Trust joint initiative on research and epidemic preparedness and response has been launched through that. And in fact, last week we had our Cabinet Secretary for Development do a virtual tour of Kemri Wellcome in Kilifi, where we talked about joint work on vaccines. So that is very much in the health part, but we know that we're going to have an awful lot of requirement for technology to get a vaccine ready and scalable globally quickly, quickly being a relative term in that context. The UK Kenya Tech Hub, many of you will know Sheena, who's on the call today, who's our director of the Tech Hub, supported the COVID-19 hackathon with Government of Kenya and many of you as well. I'm sure 300 applications from innovators across Kenya addressing those challenges. The Tech Hub have also mobilised rapidly in response to COVID with a Business Connect programme, the Jacaranda B2B platform, which supports SMEs with access to market information and credit, and a portable benefits portal for gig economy workers called Perks. We've also launched the Africa COVID-19 Innovation Call to pilot the manufacture of urgently needed products, including protective face masks for frontline medical staff. And our innovation networks have helped to support Kenyan entrepreneurs using locally sourced materials to produce new kit, including a prototype ventilator. I think that's probably enough. I just mentioned that UK Aid is funding the GSMA Mobile for Development programme. We've launched an innovation fund on digital inclusion, focusing on accessibility, affordability, digital skills, safety and security. And that there will be an outcome of that round announced later this year and more funding to come. And the Kenya Catalytic Jobs Fund, I think Ronnie's on the call, who runs that for us, has created a COVID-19 window to support innovations responding directly to the pandemic. So a really notable pivot for us, working always in partnership, because we need we think the partnership is strong, where we bring UK experience and Kenyan local brilliance. Two things I just want to mention before I end. One is we're establishing an innovation challenge board. It will be launched next month. This is, I think it's 14 professionals that we have handpicked. Half of them are Kenyans, half of them are Brits, or at least based in one or other of the countries. Across different sectors, who are going to push us to make sure that we are being sufficiently ambitious in the partnerships that we bring to Kenya to support innovative, disruptive, tech-enabled business. And we are launching an innovation cluster. So this is partners who have received UK funding, who are establishing in Kenya. It would have been a physical cluster based in Nairobi Garage. That feels very last year, so we're adapting it to being a digital community so that they can benefit from those externalities of clustering, even if they can't do it physically. We put together an occasional newsletter with all the opportunities, including the funding opportunities that are currently available for innovators and entrepreneurs. That includes the Royal Academy for Engineering Africa Prize, Innovate UK's Agritech Catalyst, and the Connected Places Catapult. If you would like to receive that newsletter, it only went out last week, so it's still very relevant. Let me or Sheena know. We always want to be pushing out information about UK partnership opportunities. I leave Kenya in 4 weeks, really sad to be going, but I'm glad that we've got this really strong partnership across tech and innovation, and I hope you'll all keep it going. So good luck and thank you very much. Mercy or Ori, back to you.
Thank you so much, Susie. You will be missed. I hope you will still remain with us in spirit. We appreciate all the contributions that you've made so far, and hope you stay well and safe travels. Finally, before we go over to the innovators, I think we have some very brief remarks from PS Jerome Ochang. If you can, I'll hand it over to you now. Thank you.
Well, thank you very much, Ori. And let me first of all start by expressing apologies from the Cabinet Secretary, Joe Musheru, who would have really wished to be with us, but due to the exigency of other duties, he's not able to join. But then he had prepared some talking points that he really wanted me to pass this message to this team. And I will just read his comments. As he says, thank you very much, Susie Kitchens, the UK Deputy Commissioner to Kenya. And it is really sad to note that, no, that's not Joe Musheru's. I just want to comment that you've been a very strong partner and you really be missed as you leave. But like Ori says, I believe we will be together in spirit. Well, I'm quite excited to join this afternoon at this inaugural webinar by the COVID-19 ICT Advisory Committee to get a glimpse of and interact with innovators who have extended their creative minds to come up with homegrown solutions to mitigate the impact of COVID-19 in the country. I understand that the selection of the shortlisted innovators has been extremely a rigorous process, and I must thank the committee for the tremendous strides made thus far. One of the terms of reference for the advisory committee is developing and implementing a framework for identifying, supporting, and scaling local ICT solutions that can support the country in its effort to combat the COVID-19 pandemic effects, to establishing an enabling environment that will stimulate economic development through ICTs. The response for the call for innovation has been exponential, and want to report that we have received over 500 innovations submitted for review, out of which 400 have already been reviewed and even demos done for those shortlisted. This is really a clear demonstration of the kind of technical capabilities that our people have and which the country must now tap into as a way out of this pandemic and for future national growth. It also reinforces the fact that the future of work is really digital. This is no longer a myth. It is the new way of life, as the various innovations are responding to the impact of COVID-19 on critical areas such as food, economy, logistics, transport, security, and livelihoods. In examining the viability and scalability of the proposed solutions, the committee has forwarded several proposals to my office for review on key ICT initiatives and policies to respond to the pandemic and beyond, in order to mitigate the effect of the pandemic on individual livelihoods, communities, and even the economy. I am pleased that through this process, the committee has forged mutually beneficial partnership with other like-minded institutions such as the UK AID, Strathmore University, Vilgro Kenya, ANDE, amongst others, to support innovations. Indeed, technology is now the bedrock of every sector and thus technology solutions and innovations are now in very great demand. I therefore wish to challenge all innovators to rise to the occasion and take advantage of this opportunity to exercise their creativity to not only provide solutions to our present challenges, but also widen their scope and anticipate what the future problems could be. As a ministry, we are committed to empowering and supporting the growth of the digital economy and the gig economy. This space has therefore been created to ensure that there is room for all the great minds and thinkers to thrive by bringing to life their innovative ideas. We want to see Kenya become a global competitive knowledge-based economy, and as such have taken major steps to ensure our attractiveness to local investors and innovators, especially with the Buy Kenya, Build Kenya policy. We will continue to leverage on ICTs as an enabler, not just for the Big Four agenda, but also as the new frontier for attracting global digital job opportunities. Indeed, it is now my pleasure, and I now wish to invite us all to listen to the grand ideas that our innovators have to share with us as Kenyans, and indeed, the whole world is waiting. Thank you very much.
Thank you, Bwana PS. And there's been a request that for the next showcase, we might want to hear what some of the initiatives the government is undertaking, that sometimes there's too much pressure on the innovators, and perhaps hearing from how strategic parastatals like Posta and others are also thinking about positioning for the future around digital. So I hope for the next showcase, we can also hear from some of the initiatives that government is taking on their side. And thank you very much for being with us today. So without further ado, I think we're just about
maybe
10
Ori,
minutes.
before
Yeah,
we leave that, I take note. I've actually been following the conversation. It's only that it is not a question answer session, but then I take note of all this, and probably, like you rightfully say, in the next discussion, then we'll be able to address each of these issues raised. Thank you.
Thank you very much. And without further ado, I will invite our first presenter, Imarisha Afya. And just to note for everyone, we have tried to, as we submit our shortlist, to balance out between some earlier stage startups and those who are more experienced, and also to make sure we're representing sort of diversity of experience. So please be gentle to the presenters. Some of them, this is their first time doing a demo in a forum like this. You know, please do share your feedback in the comments. So if we can have Imarisha Afya, I think you should be able to share your screen. And, please go ahead.
Thank you. I am. I hope I can be heard audibly, and looking forward. So we'll start with a framing of who we are. This is a sad but true story of one of our customers called Joseph. Joseph was a fisherman in Lake Victoria, and his wife was diagnosed with kidney failure. Joseph needed 36,000 Kenya shillings to be able to start. Sorry for that. I just got a notification that there's an error with my video. So I'll start the same again.
Sorry, Adelaide.
Sad but true story of one of our customers called.
Always show.
They don't, huh?
Yeah,
Okay.
Sometimes it's a challenge with Zoom, so you might just want to jump into the.
Let me just dive in. Okay.
Yeah.
Okay, sure. Sure. So, sorry for that, guys. I'll go straight in and I'll just narrate our story as it is. So, we always start by framing a sad but true story of one of our customers called Joseph. Joseph was a fisherman in Lake Victoria, and his wife was diagnosed with kidney failure. Joseph needed 36,000 Kenya shillings to take his wife for treatment. Unable to raise this, Joseph did what most of us Kenyans do. He went to the community to fundraise for her treatment and dialysis. And unfortunately, 2 weeks down the line, Joseph only managed to raise 12,000 Kenya shillings. It's at this stage that Joseph was forced to do a very desperate thing, that is, sell his fishing boat and take his wife for treatment. While she was undergoing treatment, again, unfortunately, his wife passed on. And Joseph had to do the painful thing, which is go back to the community again to fundraise for her burial. What is really unfortunate is that during the burial fundraiser, the community raised more than double what he needed to take her for treatment and potentially save her life. Joseph's story is a very sad reality on how most of us Kenyans and Africans in general address and face risks. Joseph requires a vast array of microinsurance solutions, healthcare, life, disability, to enable him not sink so much further into poverty. And that is why here at Blue Wave, we say we work for Joseph. So the challenges that we are really seeing, or the main focus that we're addressing with the existing healthcare financial models, you're familiar with the NHIF, the universal healthcare. We are familiar with conventional health insurance products, and in some cases, the capitation scheme. Now, these challenges have faced this market where we still know that almost 80% of us Kenyans still lack access to health insurance. So what we're trying to ask is, what is causing this potential gap? There are 4 core barriers to insurance uptake currently. 1, conventional health products are very expensive. There's a huge gap in Joseph understanding how insurance generally works. And almost 90% of the average population that we deal with have a very negative experience with insurance, or know somebody who has had a negative experience with insurance. And lastly, Joseph will have to travel almost 10 kilometers to the city center, fill in very complicated forms, expose himself or his family to medical tests, and before he's able to onboard into insurance. So high premiums, marred up with low benefits, a very subjective panel, fraud, poor service quality, and very recently, we have had many challenges with claim disputes with hospitals, where many people cannot access healthcare. And now we know the sad reality that almost 17.2 million Africans are being pushed below the poverty line annually because of out-of-pocket expenditure in healthcare. So there is a huge gap that requires a lot of resolving. So the solution which Imarisha Afia presents is affordable, quality access to healthcare. And how do we do this? We have designed a very innovative model that will enable us Africans to access healthcare at whatever premium we can afford, and further, access a vast array of healthcare benefits within the selected panel that you prefer at the money that you can afford. So making sure that we can be able to bridge this cost barrier, build in educational platforms that educate people on insurance, and this takes care of COVID, and most importantly, encouraging telemedicine, which enables people to actually get access to healthcare before they actually are exposed to transmission of the pandemic and receive treatment from home. We have built a robust IT infrastructure that will enable Joseph, with just a basic feature phone in less than 20 seconds, use our USSD, IVR, voice, M-Pesa, and access, enroll, and use and make a claim policy from start to finish. And of course, our APIs and our infrastructure also caters for the high-end devices to collect more KYC and more geomapping location of our clinics. We have raised 300,000 to date. We have about 30,000 customers based here in Kenya and Malawi, founded in 2017. And our vision is to collaborate with you and launch successfully our comprehensive healthcare cover within this country. Our team is diverse and highly experienced, bringing in almost 30 experience cumulatively, cutting across insurance, telecoms, IT, MNOs, and actuarial science. With a robust team of young individuals striving every day to bring insurance and healthcare closer to Joseph. Our ask is really to first collaborate with the government and open up doors within government agencies, relax regulatory policies through the IRA sandbox to test and pilot Imarisha Afya. We are raising our first 1 million bridge towards a 6 million fundraise. And the idea is to get at least USD 300,000 in grant funding through the MasterCard Foundation or the Kenya Catalytic Job Funds initiatives to enable us employ close to 1,000 youth foot soldiers on the ground to catalyze our product across this country. That is our vision and our story. Thank you for listening. And our aim is to really change Joseph's world. Thank you.
Thank you so much, Adelaide, and within time. And please, if you have any questions and feedback for her, reach out via chat, and we'll be sharing at a later stage everyone's decks and profiles on the website so that you can follow up with them if you're interested in learning more. Next, we have the Afya Kit team. If you could please go ahead. Thanks. Frida, we can't hear you or see you. Okay. Please go ahead. We still can't hear you. I don't know whether it's just me. Okay, go ahead. Can everyone hear her, or am I the only one struggling?
We can't hear her.
We can't hear you.
We're not here.
We can't hear her.
Perhaps if you check on your audio, we can have the Daktari team come up next, Frida.
Okay, can do that.
Okay. The Daktari team. Great. Hi, Panvi, if you could, okay, I don't see you on video, and maybe unmute and you should be good to go, Tanvi.
Great. Okay, can you hear me?
Yep, we can hear you and see you.
Yes, we can.
Go
Great.
ahead.
Good afternoon, ladies and gentlemen. My name is Tanvi Shah, and I'm the CEO and co-founder of the Pill Shop, recently rebranded as the Daktari. Okay. The Daktari is a digital health tool consisting of 4 main modules: an online booking appointment system, a patient management system, an e-prescription module, and a teleconsult program. Why is the Daktari a great solution during the COVID-19 pandemic? 1, our booking appointment system. Currently, there's no formal booking appointment system in most public healthcare facilities. This means there's a lot of traffic in waiting rooms with minimal social distancing. Our system is able to fine line appointments, ensuring patients arrive just before their appointment, and the waiting time is drastically reduced. The Daktari also sends automatic text message reminders the day before the appointment and on the day of the appointment. This can also prove to be useful when carrying out contact tracing, since the system can show which patients visited the clinic at a particular time. The other issue we have seen since the start of COVID-19 is patients are afraid to visit clinics for other non-communicable diseases, such as cardiovascular disease, diabetes, and kidney disease. we have developed a teleconsult program where patients can be seen remotely. Appointments are booked on the Daktari. At a specific time allocated, the doctor calls the patient either by telephone call or video call. Patient notes can be entered on the patient management system, and if a prescription is required, this can be done by the e-prescription module. This is also useful when reviewing lab results for pediatric well baby clinics or routine maternity checks. This is a screenshot of our booking appointment system, so where the doctor date and time slots can be selected and the appointment can be booked. This is a screenshot of the patient management system. So it shows the doctor can get basic details of the patient, such as the blood group, age, or medical history before even seeing the patient the first time. This is an auto-generated e-prescription from the system. The doctor can be able to send this to the pharmacy directly for dispensing, making the process quicker for the patient. It's a much more legible prescription than a handwritten one. We have already implemented these solutions in private healthcare facilities with 115 clinicians from different specialties using our system. I'd like to go through one of our success stories, Jacaranda Maternity Hospital. This is an NHIF accredited hospital with quality care at affordable prices, making it a popular hospital in Kahawa West. Prior to using the Daktari, their biggest issues were long waiting times, too many people in the waiting room, patients only coming in at the beginning and before delivery, but not for the follow-up appointments. There were many patients who would come in to see the gynecologist, and their biggest complaint was that they waited too long, and sometimes they weren't even seen by the gynecologist on the same day and had to return the next day. Once the clinic started using the Daktari for their appointments, they found the waiting time reduced and that all patients who came in to see the gynecologist were seen on the same day. The next appointments were booked before they left the clinic, ensuring they received reminders, and they found patients were coming in for routine checks. The table on the right shows the waiting time data at Jacaranda Maternity. At Jacaranda Maternity, the gynecologist usually arrives at 9 a.m. However, patients begin to walk in from 7 a.m. with the aim of being seen first or as early as possible and being able to leave early too. But according to the table, you can see the patient who arrives at 7 is seen at 9, patient who arrives at 7:05 is seen at 9:30, and so on. As an example, let's take the patient who arrived at 7:40. This patient will be told there are 5 patients ahead of her, which seems like a small number. In reality, this patient will most likely be seen at 10:35. This is a 3-hour wait just for the initial gynecologist consultation. In many cases, labs may be required or an ultrasound may be required after the consultation. We can see the difference a booking appointment system can make on the entire flow. Patients don't have to come early and spend the entire morning waiting to be seen. These patients could go to work or to school and come at their specific appointment time. I'd like to go through a testimonial from Christine Ossia, who is the manager at Jacaranda Maternity. Through the Daktari at Jacaranda Maternity, we were able to bridge some gaps that initially were affecting our customer experience. For instance, we were able to follow up with our regular clients. We also had a decrease in wait times, which resulted to an increase in the number of clients seen per day. It was an easier way for our clients to schedule their appointments through their phones rather than calling to make an appointment. Clients received confirmatory messages after booking, which also acted as a reminder. In overall, the hospital rating went up due to the good customer reviews we received. So being a digital solution, it won't take long to set up the Daktari. Weeks 1 to 2 will be utilized in evaluating which clinics would like to start using the Daktari and which module in particular. In this way, we will plan deployment of staff. Weeks 3 to 4 will be for setting up the Daktari and creating user profiles. Staff training can then be carried out, and weeks 5 to 8 will be used for help and support where required. Our costs for using the Daktari are as follows. We charge 5,000 shillings a month for the booking appointment system and patient management system to the clinic. We charge 10,000 shillings a month for the e-prescription module and 10,000 shillings a month for the teleconsult program. So this is our Daktari team. I am the CEO and co-founder of the Daktari. I'm a pharmacist by profession with a master's degree from the University of Bath. I have over 8 years of experience in the UK, US, and Kenya. The other members of the team are our Chief Finance Officer, Head of IT, Head of Finance, and our Chief Marketing Officer. These are our contact details. Our email is info@thepillshop.com. Our website is www.thedaktari.com. Please follow us on all social media handles. Thank you so much for your time. If you have any questions, please write them on the chat. Thank you so much.
Thank you, Tanvi. Well done. And if there are any follow-ups, please reach out to her on the chat or on this contact information that she's shared. Next, we have coming up, before we go back to Afrikit, I think I'd like Ronnie with the M-Safari team to go next, if that's okay, and then we'll go back to Frida and Afrikit. Ronnie, over to you.
Thanks, Ori, and thank you everybody for joining us today. My name is Ronnie Osumba. I'm the founder and CEO of iGov Africa, and on M-Safari we have partnered with Fab Labuinam from Kisumu to build their solution. So, okay. This, I think, is a view that most of us have come to grow up with in regards to our public transport system. It's an experience that many of us have had. Personally, this is how I grew up, going to a school, having been born in Kibra, going to a school in the CBD. This was my experience every single day. Of course, public transport in Kenya has come a long way to be a bit more formal, but the informality of the sector still persists. The WHO in this particular season has identified public transport as a potential area of COVID-19 exposure. If you take, for example, Nairobi, which has 4 million residents, 25% of our residents use public means every day. This is matatus or bodabodas. So to minimize the risk of contagion, Kenya, like many of its compatriots across the globe, has put in measures for public transport. So disinfecting the vehicle, physical distancing within the vehicle, and having a load limit of up to 60%. And of course, continuous communication around the risks presented by public transport. But the gap remains in contact tracing, due largely to the lack of passenger data and passenger manifest. So what we do at M-Safari is we have built an innovative mobile-based solution. It is a USSD platform that enables commuters in public vessels basically to use their mobile phones to check in, but also to make cashless payments. So ideally, M-Safari therefore enables all passenger vessels, whether that is a bus, a matatu, a ferry, a train, to provide critical data to public health officials in the event that there's exposure within the vessel for purposes of contact tracing. We have also built in value additions to include checking into public spaces like buildings, markets, places of worship, libraries, for the same purpose of contact tracing. We have developed now an Android and iOS app, and we have also provided for analytics on the use of transport infrastructure. So how does this solution work? Ideally, you board a vehicle, you dial *483 *82 hash. You declare yourself or for a passenger whom you're traveling with. You enter the registration code for each vessel, which will be unique to that particular vessel. You enter your destination. It then prompts you for your M-Pesa, and you enter the fare, you put in your PIN, and it sends you a text message, most importantly, having the vehicle registration number. So what happens if there's a need for contact tracing? The data that we have collected, which includes your mobile phone number, which is anonymized, the vehicle registration number, your destination and GPS location, but also a timestamp, will help with tracking and tracing protocols. So we pull up the passenger affected, It shows us the vehicle they have traveled in. We pull out the manifest from that particular vehicle, and all the passengers are contacted. But there's also tracing using GPS and working with the telcos. Obviously, then, depending on the case, each is sent to quarantine or self-isolation. So this is what the user interface looks like. You have a USSD check-in, and that is what it looks like. You have mobile app screenshots, which show you what the mobile app then would use. We project that 90% of our users, who are mostly in peri-urban or rural areas, will use the USSD. We then provide dashboards for authorities, public health and TSA, for example, to just check on usage of public transport. This platform can also be used to confirm whether they are meeting the guidelines of 60%. It shows the commingling, which is basically the contact tracing tree, but also just shows other analytics. What is our theory of change? Our theory of change is that if we can, in the short term, provide public vehicles with passenger manifests, and therefore be able to have usable physical contact tracing data for all commuters, and provide data and analytics, in the medium term, we will increase integration between public transport information and health information management systems for Ministry of Health, but it will also increase the use of public transport data to track and trace the spread. So we all know that the virus doesn't move, it is people who move. So we need to be able to provide platforms that allow us to analyze how people are moving, and eventually the long-term impact is then reduce COVID-related morbidity and mortality amongst 60% of urban residents. So far, in terms of going to market, we have approval from the government of Kenya. We presented to the National Emergency Response Committee, which has approved this for use. We have been sent to NTSA, for whom we have presented to. They have called in their stakeholders, so matatu owners and operators, for whom we have presented to as well, and who insisted on having the cashless, so that they can be able to remove the need for exchange of cash on the vehicles. We are now subsequently awaiting the final approvals from the regulator. We have finalized on a business model, but need consultation, post regulatory approval with all the stakeholders. And then we want to work in a model where we incorporate the SACCOs and the route managers before we go to launch. We are closely working with UK Kenya Hub, Tech Hub as well, who have provided support for us. The team is made up of myself, who's leading, based on my experience in the telco industry, working with regulatory bodies. Martin Olo is a co-founder as well. He's our stakeholder lead, having vast experience working in the Lake region with FabLab. Our developer, our lead developer and co-founder is Tyra Soyo, also based in Kisumu. We have Shivachi Mulenji, who's the general manager in charge of M-Safari, vast experience in Uber, Bolt, and recently managing the Kenya team at Shrivel. We also have Michael Kamande, who's our project manager, vast experience again working with developers in taking products to market. And finally, our head of payments, who has over 8 years experience developing payment platforms as part of the team. This is how you reach us. We are based at Lattice Community Center along Gong Road on Applewood Adams. And those are our contacts, email address and telephone number. Thank you.
Thanks, Ronnie. And I see already several questions in the chat room, if you want to pop in there after this and respond to them. And also, if there are any funders in the room, I think they're also working on a raise, but I'm really encouraged again to see the diversity of innovators and working with the Fab Lab in Kisumu to help this go to scale. So thank you for that presentation. I think next we'll go back to Frida. I hope you're all sorted now.
Yes, I am.
Yeah, we can hear you. Great. Go ahead and project.
Thank you. Thank you very much, Ori. Hi, everybody. Sorry for my mishap earlier. I hope you can hear me clearly now. My name is Dr. Frida Njogu. I'm the CEO and one of the co-founders of AfyaKit, which is a digital health startup that provides actionable insights to health decision makers in Africa. And what this product is trying to address is really a dual problem, where we have poor quality of healthcare and inefficient operations in health facilities, which is quite costly. In Kenya alone, we lose every year about $750 million because of inefficiencies in health spending. In sub-Saharan Africa, that comes to $30 billion. But more importantly, in Kenya alone, we lose about just over 50,000 people every year due to poor quality of care in health facilities, not those who are dying out there, but those who actually come to us, but because of our poor quality of care, they're actually dying. And this translates to about 6 people in Kenya lost every hour. And this inefficiency is significant because for every 2 people that we treat, we could actually be treating 3 people. I'll just share a short, story that as a young doctor, I remember one day I lost 4 children on my call. And I mean, I haven't forgotten about this. Every time I think these kids could be 18 years or so, but really the reason why we lost these children is because of lack of very simple things, lack of IV fluids, simple antibiotics, etc., etc. And so we are losing lives because in the public health system that I worked in, we are not efficient. We are not providing, much needed resources as required. And often as a health manager, maybe in charge of a county or a government or even an organization that's supporting government, we often are stuck wondering, what is a specific issue where and when. I'm having a lot of people dying because of this condition, but I don't know, in region A, they may not be having health facilities, within a short distance to their homes. In another facility could be vaccines or, drugs are not available. In another facility, staff are not trained. So when you don't have this information available to you in a very useful format, then you broadcast resources. You decide to train everybody, but really maybe in that facility, what was needed was a very simple thing. Just ensure that, the staff are trained, or ensure that the fridge has an electricity connection to, so that services are provided. So this kind of information is lacking at high levels where decisions are made. So our solution is called AfyaKit. As I mentioned, it's a mobile health platform, digital health platform that provides this information. And we figure that by using it, actually, we're likely to save a significant component of the amount of money that is lost every year. About $100 million could be saved in Kenya annually in health, and about 10,000 lives saved because of improved quality of care every year. And this is what it looks like. As I mentioned, it's a mobile-based platform in which various health managers at county, sub-county, and even facility level enter operational information. So in terms of staff training, capacity, service availability, etc., etc. And the platform converts it into actionable insights that are then provided to health managers to guide interventions to improve quality and efficiency of services. And this is the kind of information that we're able to provide. We're able to provide, varied information. Even in these days of COVID, we're able to tell you, this facility has got this equipment. Is equipment available? Is it working? Are staff trained, etc., etc. This information is provided in various manners, including, overlaid on geomaps, detailed reports at facility level for action, aggregated data at national level, and so on and so forth. So our platform has been used, especially in Nairobi, and initially we used this for maternal and newborn health services, but later on we've been able to expand to include even COVID, HIV, general outpatient services, etc., etc. And we were able to track the impact of our work after about a year of implementation. And in the facilities that we assessed, there was a significant improvement in readiness of the facility to provide the services. So for instance, staff were trained just by us availing information and not providing any more additional resources. The county was able to reorganize their already available resources to improve readiness. So in terms of staff training, availability of protocols and guidelines, reduction in facilities reporting stockouts. But I think more importantly, on the right, there was significant improvement in quality of care provided. And the one I've highlighted is really one that is dear to my heart. there was a significant improvement in the women who were provided life-saving medicines to prevent bleeding after delivery. This is dear to my heart. I had postpartum hemorrhage, and I know this is a touch and go situation. So if these drugs are not available or where they are required to, and with staff who know how to use them, then you have a problem. So, so just our information alone was able to help these managers do what was required for the women. So we are in use in about 150 health facilities so far, and with your help, we are hoping to expand this to about 1,000 health facilities by the end of the year. And we're looking to raise about $500,000, which will largely go into product development and business and user acquisition as well, and partnerships with various players, including governments, value chain players who are interested in some information that we can provide, such as when to provide plan for equipment maintenance and others. Really, our team is diversely experienced and skilled. We have data scientists. Kennedy is trained out of Harvard. We have health experts such as myself with significant health, public health, and consulting experience. We have Rosalind, who's an expert in operations and legal, and also Moses as well, a public health professional. We have received support from various organizations that have acknowledged the kind of work that we are doing. Yeah, that is really it. We are based in Milimani, NAS Apartments, and you can reach us on info@afiakit.com. Thank you very much.
Thank you, Frida. And if there are any questions, please ask them on chat. I think one of the things I like about this solution is that it focuses on the inefficiencies, as you've said, and not just on the mass training or mass funding, and yet the issues are quite basic. So thank you for your presentation. Up next, we'll have the portable hand wash station team. If you could line up. I hope the video works.
Yeah, I'm ready.
Hi, Jeffrey. Okay, please.
Hi,
go
how are
ahead.
you? Yeah, thank you. I wish to start by presenting a short video.
Is it still loading on your side?
Can you can see the video? Eh?
No, we can't see anything. So I think so maybe post the link, because I think yours was on you. If you can post the link in the chat and people can watch the oh, there we go. Looks like something is happening. Let's see.
You can see it now, eh?
Yes, we can.
Okay, good.
Maybe just share the link as well. It's a bit slow.
Okay.
And we can't hear the audio, so maybe just share the link in the group. Okay.
So let me present then the PowerPoint.
Yeah, go ahead and maybe just maximize it so that we can see better. So, Jeffrey? I think
in the market anytime you are in, and in the process of doing that, it gets decontamination. So I am on the problem statement. I hope you can see it.
We can see it, but I might ask you to turn off your own video and just talk because the connection is not great.
Okay,
Yeah,
I've done that.
there we go.
So yes, thank you, Matt. So the background of this innovation is on hand washing and sanitizing, which is one of the protocols that government has identified as very critical in the fighting of the COVID-19. And therefore, I found that the gap that exists in the public is that there is risk of secondary contamination after you are done with the washing. So this system comes as a serial innovation. That means there are 3 products in one. The first product is a portable hand wash unit, and the second product is the automatic sanitizer booth that can be used with the parcels, luggages, and for hands. And the third item is automatic vehicular hand sanitizer that can be used with the PSV vehicles. The first one looks like this. This portable hand wash unit has a pump. Instead of having a tap for opening water, it has a pump that is controlled by USB power, which can be powered from even a power bank or other sources of USB power. The next item is a sanitizer booth that has a sensor for you to be able to censor anytime you want to sanitize a parcel or a bag for a student or even your hands. And all you do, you press your hands below the sensor, which you can see there, and then it will be able to release the spray of the sanitizer. The third product in the serial innovation is a sanitizer system for matatus. This system is able to work with a 12 DC power volt that can be supplied from a normal vehicle power battery. At the entrance of the vehicle, it can be mounted by either screwing it up there or can be mounted with some assembly there. And once you mount it there, as the passengers are getting into the vehicle, all they need to do is to put their hands below the sensor, which is indicated over here. And once they do that, it will be able to release for them the sanitizing gel or the spray. And when they do that, they can get into the vehicle. The system comes with its own bottle, which has a reservoir capacity of 1 liter to 1.5 liters, enough to take some of the long distance vehicles even for the whole day. Then the potential uses of these systems is one, for the usable portable hand wash unit, it can be used in homes and offices. And it can be a do-it-yourself assembly. That means existing buckets and other systems, it can be assembled into it without somebody having to build like you're building a new system altogether. But the ones that I tend to produce, they'll be ready kit, complete for ready deployment, but one can also buy the assembly kit and do the assembly for himself. The other one is the automatic sanitizer booth, which I said it's able to do the sanitizing of luggages, parcels, and even hands. I propose this one to use for places of worship, in offices and schools, and therefore it can find very versatile application. The last one, which I talked about, is a vehicular system, which, as I explained, can be used in a matatu. The reason for this particular system is that it's made of stainless metallic material, meaning it is able to withstand the environment where public users may not be as keen as within an office. The market entry, I'm planning to produce 1,000 units of each. And in this one, I will target first and foremost the retail market. We are intended to work with the hardware shops to be able to partner with me so that people can manage to see the product. And upon order, we can either ship directly or we can stock with those particular hardware shops. The other way that we want to do this is through demonstrations, through large customers and consumers, particularly with government agencies and regulatory authorities. The one for the motor vehicle, we are planning to visit NTSA and be able to pitch our case there for them to be able to appreciate it so that they can recommend it for all the major operators in the industry. And the one for the other way is through the public event showcasing, like the one we are in now, so that we can manage to access the mass market by attending events, gatherings in churches and other institutional events. Our funding expectation is for about that $1 million to be able to carry out all the 1,000 units to distribute for each of the product, meaning a total of 3,000 units to start with. And that means a cost of around 10,000 a piece. The team that has done this is myself and my son. So I am a lecturer and also with 15 years experience in senior management and author of 2 books and an experienced entrepreneur and innovator. My contacts are provided there. And the other partner with me is my son, who is a 4th-year student at Maternity University. pursuing Bachelor of Electrical and Telecommunications Engineering, and his contacts are provided there. I want to take this time to say thank you for listening.
Thank you so much, Jeffrey, for your presentation. And if there are any questions for him, please ask them in the chat. As you can see, as much as we're supporting tech-based solutions, I think the link between the tech and the hardware, and you can see all the possibilities it can stimulate in terms of supporting sort of the dual-quality manufacturers who can then fabricate these devices. Thank you so much, Jeffrey. Next up, we have Afya Record. John, over to you.
Hello.
Hi, John, we can hear you. Please go ahead.
So sharing my screen.
Yep. Okay.
Thank you. Afya Record is a patient-driven health data platform basically set aside to solve the problem of data in healthcare and help us provide better healthcare solutions and access to better healthcare for patients. So traditionally, one of the things that we've known over time is that healthcare has always been very much about software driven by hospitals. And one of the things that we decided to look at in that opportunity was how do we create a patient ecosystem where data becomes mobile and we can use data as a way to actually solve problems and also provide better healthcare service for patients. So that's really where the concept and the premise of Afya Record came from. How do we create an ecosystem for hospitals, patients, everybody else to be able to access the one data and create mobility for data in healthcare? And in that journey, we also looked at the problem of outbreak and diseases as well. Because building an intelligent platform, we also knew we could provide a solution for alert and disease monitoring when we started last year before COVID. How do we also, as we collect this accurate structured data across multiple hospitals and also the patient ecosystem, can we use this structured data in real time as well to be able to also create alerts and management of diseases and outbreaks? So we built our technology on something very simple, which is symptoms, which is keywords, and also geo-tracking. And the idea of collecting structured data from health facilities, providing hospitals with our platform, which is basically a SaaS platform that we give to the hospitals to allow them to capture, store, and also structure patient data, and consistently allow access for that data every time the patient comes to hospital or goes to hospital B. So when I go to the first hospital, they can access my health data. And when I go to the second one, they can also access my health data. And more importantly, I get access to that health data as well, which means I'm also the sovereign owner of my health data, and potentially we could actually save the lives of over 200 million people in this continent. So that is where we started from. And in terms of the symptoms and disease outbreak, what we did was basically look at that technology and say, as we are collecting that structured data, can we also help with the problem of things like COVID? So what we're doing in the COVID situation, which is contact tracing and also using our platform for remote management of patients, is we have digitized the case investigation form here in Kenya. And in that digitization of that form, it allows the health facility to now collect the patient data from a digital perspective from day one. And as they collect that information as well, it allows them using our SaaS platform to see in real time where every patient whose data is being collected actually lives. So that as a county, a hospital, or government, you can see in real time where everybody's being tested. As that form moves on to the patient and it goes to the lab technician, you can then see where everybody who becomes positive as the map changes from green to red. So again, the county, the government can see in real time every case that is tested positive. So we then give them a zoning system within the platform that allows them to create specific and dynamic virtual fences based on accurate and structured data that they have collected. So when they do this, Every patient then who has the application, when they walk into this virtual fence, what he does is sends them a message, which can either be customized by the county or the government to say, well, you've just entered into a very high-risk location. You need to be careful and you need to do X, Y, Z. What this also does, it creates a very easy social consciousness for the patients without creating cultural problems that alert people negatively. So when that happens, as the patient also leaves that location, we also cluster the patient into a yellow, which basically means that patient is now a potential risk. And we can follow the patient and also be able to help the county or the government also track and manage the movement. But more importantly, what is extremely important when you also look at tracing and analyzing diseases is being able to sequence the symptom against the location. Because the symptom technically is the most important part in understanding the movement of any disease. So even when the patients have left all those locations, our solution continues to sequence the symptoms and also continues to sequence the location and movement of people in and out of that location and multiple locations at all these different people. And this is why a large computing analysis of data becomes extremely important in the platform. The platform also allows us to be able to help counties also manage social distancing as they use our technology to train health workers remotely and also patients with chronic illnesses, and also manage messaging similar to what Nandi County, who have launched the Afya platform, are doing at the moment with quite extensive success. So we've launched in Nandi as our test pilot. And on the data side, being able to capture patients' data, what Afya Record also does is once we capture the patient data from a dispensary hospital level 1 all the way to level 5, as the patient moves through the ecosystem, he will always be able to use his data to access healthcare. And all the health facilities, as they become part of that ecosystem, will also be able to access the patient data irrespective of what facility, private or government, that is gone to in real time. And in that solution, then we provide the hospitals with very basic infrastructures that allow them to also create efficiency, generate more revenue. We give them free telemedicine tools, communication tools, platform tools, and we give all this for free because basically for us, those are tools that allow for the movement and access of that data on that patient. And we have a very simple slogan. Healthcare happens outside of the hospital. Treatment happens in the hospital. I would like to bridge the gap between healthcare and treatment. And when we talk to specific patients, one of the things we tell them is, if you imagine Gmailing your own healthcare, basically after you finish with every hospital, you can get access to your health data in real time. That is really the power of the platform that we have done. So far, we have launched with the Association of the Sisterhood of Kenya. We launched 6 weeks ago with Telkom Kenya, our key partner, and also Microsoft. And with the Association of the Sisterhood, we've launched in 15 hospitals from level 1 to level 4, and we have over 41,000 patients now. We have also launched with Murang'a County, 5 of their public hospitals as well. We've launched our COVID contact tracing app with Nandi, and we are also in the process of launching with 2 other counties as well. And we are also launching in a number of our private clinics here in Nairobi as well, including partnership with Diabetes Trust and a few other organizations. So our platform also allows for health education. So again, we partner with NGOs and also partner with other people who create incentive-based health education, again, for consumers. The platform is in USSD, the web portal, and also the application that allows the patient to also manage their own healthcare, where they can also use it to provide information for their hospital. So I'm the founder and the CEO, our CTO, Bendon, who has been in the tech space for a very long time here in Kenya, and also our co-founder, Irene Kira. What we're looking for is the access to be able to provide our platform to as many partners as possible and help also the government solve the problem within this COVID period. At the same time, provide our software for hospitals to begin to capture accurate, structured, and organized data across the whole ecosystem, and also funding as well. Thank you.
Thank you so much, John, for the presentation. Very clear. See some questions in the chat asking how you've been able to implement this in low technology spaces. So I'll leave you there to follow up on those questions, and thank you so much again. And those are John's Afya Records details if you'd like to get in touch. Next, We have a portable ventilator. If you're ready to present, and John, you might want to head over to the chat. And if you could stop sharing the screen as well, so the next presenter can share. Thanks. Hi, Anthony. If you could turn on your video as well so we can see you. Anthony? We can't hear you if you're talking. Anthony, are you there? He seems to be having technical difficulties. Maybe as we wait for Anthony, if we can line up My Health Africa. I think it's Janet who's presenting. Please go ahead, Janet. And you might have to unmute Janet. Oh, Jane, sorry. Hi, Jane. Are you able to turn on your video? Okay, please go ahead. Go ahead, My Health Africa.
Ori, I can hear you.
Okay, now we can hear you. Please go ahead.
Yes. So I'm saying from My Health Africa, this is Kimani Jane, Business Development Manager, East Africa. So at My Health Africa, we're transforming the way patients find health services across Africa and the way medical professions interact with their patients. So the problem compounded by the COVID-19, for doctors, they have time and technical constraints to create and implement new technology. And for the patients, there's no visibility across Africa. Like the patients do not know where to find a good doctor that they can easily communicate to. When we look at the rural areas, there's limited access for medical professions. As we all know, most of our specialists are located in the urban centers. And so at the moment, the patients who are in rural areas, they're having that challenge of seeing a medical profession. The COVID-19, this has compounded the issue faced by many patients looking for convenient and easy health services. So with the My Health Africa Medicine Professional Platform, our vision is to be the largest integrated health platform in Africa. So one, we have a powerful booking and scheduling system where the doctor of the clinic can be able to schedule all their appointments. We have secure and scalable telemedicine, automated patient confirmation and reminders via WhatsApp, SMS, or email. We also have doctor/patient chat. This is where the doctor and the patient can chat during, before, and after consultation. And also the patient can be able to upload medical records so that the doctors can go through them before writing the prescription. We have convenient payment method. The patient can pay via any mobile money process. We have easy online e-prescription. When the doctor prescribes a prescription to the patient, automatically it goes to the patient and they can pick the drugs from the nearest pharmacy. We also have remote second medical opinions, where the patients can have medical opinions from the specialist. With the COVID-19 telemedicine emergency response platform, My Health Africa Group has developed a secure telemedicine emergency response platform to help patients consult with a medical professional remotely. So with the tab, it will help the patient to communicate with an authorized doctor on an online platform and seek guidance on the best course of action. So this one will limit physical contact between patient and doctors. So it is saddening to have our doctors get sick when they are attending to the patient. So with this one, they can just communicate remotely. And also at the moment, we know we have home-based care for the COVID-19 patients. So they can still communicate with the doctors and know what to do next. My Health Africa Group will provide telemedicine, the TAP, free of charge to the Ministry of Health. And the Ministry of Health will provide this service to the patients for free for an undetermined period. This is as long as the COVID-19 is with us. So the TAP is ready to launch, subject to final approvals by the government. And upon successful launching in Kenya, My Health Africa aims to offer the COVID-19 TAP for free to other governments also in Africa. So our execution plan, we are already live and we have tested the platform, prove that it is working well. We also have partnership with an international NGO in Kenya to implement our online telehealth services in the clinics. This will enable the rural patients to communicate to doctors in a more affordable and accessible way. We've also expanded our services to Uganda, South Sudan, and Somalia. With the right resources, we can expand quickly to ensure patients are able to access remote health services. We can market the platform to let more patients to know about us. And also, we can continue on building our current services and also build new services based on demand from doctors and patients. Gaining additional services will be important to scale up the COVID-19 TAP, which we want to offer for free to the government of Kenya and other governments around Africa. So we have our key team members. Ryan Marigoas is our CEO. He has worked in various countries, Uganda, South Sudan, Kenya, Sierra Leone, DRC, Zambia, just to mention a few, in the sectors health, agriculture, finance, and government. We have Nazarian Jiro. He has built the MH platform and the COVID-19 TAP. We have Sylvia Mkwena is our developer. Doreen Awar and Michael Barrio, they are our senior coordinators. And here I am, Business Development Manager, East Africa. Thank you so much. Please visit us on myhealthafrica.com. And if you have any response, you can respond to Ryan at myhealthafrica.com. Thank you. Have a pleasant evening.
Thank you so much, Jane, for that presentation. Please check through the chat to see if there are any follow-up questions. Do we have, Anthony, are you back in on the portable ventilator? I don't see him back in, so maybe just send me a message, Anthony, once you get back in. If we can now then move over to the education folks, we have three presentations there. If you can start off, Tony, with you with Kitabu, if you can please go ahead. Tony, are you there? Yeah, Tony? Are you ready to go? Tony, can you turn on your video as well? And then you should be able to share your screen. And next after Tony will be revision wise, just so that you get ready. Tony, are you having issues? You lost him. Okay, seems to be something wrong with his audio. Let's see. Tony, we can't hear you. Okay, maybe as we wait for Tony, can the revision wise team go ahead, please, next, and then you'll come back to Kitabu.
Hi, Uri, can you hear me?
Yeah, we can hear you. Please go ahead.
Okay. So my name is Theodore, presenting for Revision Wise. And what we do at Revision Wise is we've noticed that textbook farms have seen a 30 billion drop in revenues since schools closed. And this is as a result of the COVID-19 pandemic. And the challenge is, one, they cannot be able to deliver physical textbooks to students. And at the second time, now there's limited access to books from the students. And lastly, in terms of analytics, publishers are no longer able to figure out how is our content performing in different markets, how are the students relating to our materials that we publish on these physical books, and at the same time, is our material helping students improve their performance. And the other problem that we're trying to address is for students now, we've actually seen parents complain on a constant basis that now that my kids are at home, I'm not able to keep tabs on them, what they're doing. I've run out of content to keep them engaged in terms of schoolwork, and school has been pushed all the way to 2021. And now the idea is, how do parents keep them occupied? So the thing that is both is a problem to students is now access to quality and approved revision materials. We've seen on the roadside guys selling question papers for 20 shillings, 30 shillings, just that's so that students can actually revise. And it's not actually approved content, and it's difficult to figure out where this content has come from. And at the second time, content is very costly. Most students end up paying about 500 shillings to 1,000 just to buy a revision book. And this book, they'll end up using only mathematic papers, or they'll only focus on class 8 papers, and they do not need all other revision materials all the way from class 1. And the idea is now, how then do you specify in terms of you give them the right content that they want to revise and that is useful for them? And the third part that we want to address is there's limited analytics and insights. So at the end of the day, as soon as a student has finished a physical question paper and the parent has taken their time to mark, or the parent has hired someone else to mark this question paper, there's difficulty in finding, is my kid improving over the past 2-3 months? Which areas are they struggling with? And so it's now difficult to find analytics on this performance. And what now we're offering as a solution is RevisionWise. So RevisionWise is an online platform, and we want to build an ecosystem that involves publishers, top publishers within the country. And these publishers provide us with their content, whereby we digitize this content and have it available on our mobile application. So we have a mobile application for RevisionWise that can be accessed on Play Store. And we also have a website. So from our website, revisionwise.com, you can also access our materials. And from this point, students can also be able to register within our platform and access any content at any time, specifically to what they're looking for. So if you check out our content, you can find KCP materials at the moment. And from these materials, students can be able to take up every question paper and things to do with mathematics. They can be able to sit down, do the 50 questions of mathematics, and in an instant, as soon as they're done with the paper, they get the results immediately. So we're focusing on now creating an ecosystem around it, whereby we'll have publishers, we'll have students, and we'll also have testing authorities in terms of who can be able to give us further insights on the students' performance is this way because of ABCD reasons. And also another thing that is very critical to our platform is after the student has completed the paper now, it's no longer about cramming the content, but properly understanding why they got a question wrong and why they got this other question correct. So we also offer insights on why this is the correct answer and how to improve on performance going forward. So the whole idea is our platform will be able to lower the cost of delivery for publishers. This is because they'll no longer be able to, there'll be no need for them to now be paying for shelf space in different bookshops. They'll no longer need to print revision materials, and also transportation of these books to different counties within the country will be simplified in terms of our digital platform has been able to offer this service. And then we also increase access to more customers via our digital channel. So at the moment, as I said, 30 billion revenue has been lost by publishers, but those publishers that we have on board at the moment have been able to experience some increase in revenues from the students on our platform accessing their content. So we'll be also helping publishers increase their revenue and also increasing the profit margins. And then the last thing on publishers is there'll be in-depth analytics and insights on accessed content. So this is in terms of does mathematics perform well? Does English perform well? Do students prefer this content as compared to the other? And from this insight, then publishers can be able to grow their specific content, and also this content they can be able to now tap into the specific markets that they need to address in terms of, we've seen in national examinations whereby things like KCP, Nairobi has performed better than Nakuru, or Eldoret has performed better than Northeastern. And if we're able to tap into this analytics, then we can be able to figure out why does this region perform better than the other, and how do we streamline the performance so that we can actually see an overall increase in performance for each student. And now for students, the platform will benefit them in terms of increased access to revision materials through mobile. So those who cannot be able to purchase the books for 1,000 bob can access revision materials on our platform for as low as 2.5 shillings per paper. And this material is available for them for the period of time, about 3-4 months, that they can be able to go back, revise again, and improve on their performance. And then there's an in-depth analytics in terms of student performance. So parents can now monitor how is my child performing, and how is my child performing in terms of a benchmark based on other kids within the region who are taking up the same papers. And also we offer now quality, local and approved content, because you noticed most times there's very limited local content. And I'll use an example of probably CPA. We've seen guys go around asking, where can I find the right CPA materials to revise? I want to look for Strathmore revision materials. How can I get them for me to prepare for my CPA examination? And the idea now with RevisionWise is we're definitely partnering with top publishers in the country, people who are creating this content specifically for students, and those students on our platform can be able to access this content. And it's actually local content that will definitely improve performance. And then on top of that, there's now tips and explanations on answering to aid the grasp of content, so that it's typically not cramming of each concept, but rather we're focusing now on an in-depth analysis and figuring out what these answers actually mean. So what we're focusing on is we want to go into direct sales with publishers. At the moment, what we're looking for is new publishers to onboard on our platform. That's one thing. And also we want to onboard testing authorities that can be able to help us now improve the content on our platform. We're using new technology and we want to improve how we analyze question papers that do not have actual ABCD answers, but rather things like composition. So we'd want to partner also with testing authorities. We'll bring on board to our platform and they'll be able to facilitate such instances. And then for the team now, as you can see, we have a very diverse team. Actually, it's a 50-50 mix, and the team we have has the experience in this market. They've been able to run tech companies before. There's finance knowledge in between, and we've been able to actually see a growth in the idea so far into a stage where we've had people downloading the app, people giving us feedback, and what we want now is we're moving into the next step in terms of we want to raise about 24 million Kenya shillings in terms of grant money or donor funding. So this will help us scale the application all the way to outside Nairobi, to all other areas within the country, so that it can be, one, affordable for the users, and the second time we want to be able to reduce the cost of revision within the country and also help students improve on their academic performance. And also another thing we're looking for in the future is now, as I mentioned, bringing in new publishers who will be able to offer us their content. And from our standpoint of view is we'll be doing a revenue sharing proposition with them, and we'll be able to now increase their revenue, offer them additional revenue on top of what they're actually earning from the distribution of books within the country. So in a nutshell, that is RevisionWise. You can get our application on Play Store. It's actually called RevisionWise, and also you can visit our website, www.revisionwise.com. Thank you very much. Ori, back to you.
Thank you, Theodore. Great presentation. I see lots of claps in the chat. And very clear, and then hopefully this helps you get out the awareness and the partnerships that you need. Next up, Tony, I think you're ready now to go for Kitabu.
Yeah, I am ready. Just need Anthony to, I don't know if Anthony.
Yeah, Timothy, yeah.
Yeah, sweet, fantastic. Thanks, Tony. Okay, so my name is Tony Dongo from Kitabu. Kitabu is spelled K-Y-T-U-B-U in our company. It's a play from the word Kitabu in Swahili. I'm going to run you through very quickly what Kitabu does. Okay, so just like Tony talked about, education technology is a very tough space, especially if you're in a developing country. Kitabu works to provide technology solutions to schools, parents, teachers, and students. And we have a plethora of products, 4 of them: school management system, a parent-student mobile application, learning content, and online tutoring and learning resources. I'll get into all of them in a few minutes. So let's start with the school management system. The Kitabu school management system looks something like this. The difference between our school management system and a plethora of those that are in the market is ours focuses not just on managing schools, but also on managing things like payroll, human resource, online learning, transportation, certificates, among other things. So there's a lot that we've been able to do with this. In the last 7 or 8 months, we have a little over 600 schools using it in different places. It's one of those school management systems that's like Gmail. You get online, you register your school yourself, you get your admin requirements as soon as you've proved that you are the admin for the school, and then you run the system. It works on CSV importation. It's not a complicated system. It's very easy to build, and we built it with the school IT or school director in mind. Very good for online learning facilities. So we've got everything integrated. You can integrate Zoom, you can integrate Teams, you can integrate Gumzo, which is Kenya's version of Zoom. And it's easy to work with because we know a lot of schools are struggling with this right now. But we'll talk about that again in a moment. The other thing we've done, very much like Anthony, is we focused on creating digital content for students on mobile devices. So we have Kitabu for students, which allows them to be able to get textbooks, audiobooks, videos that they can be able to rent in place of buying. So it's much cheaper to rent. If you take a book for a day, for example, it'll cost you probably 1 to 3 shillings. If you rent it for a week, probably cost you 25 bob. And if you rent it for a month, probably cost you 100 bob. But the book itself on the shelf could be 1,000 or 1,500. So that has always been a big plus for us. We've done that for about 6 years. And we also have audiobooks, which is books we've created, and videos that break down the content. Now, for parents who want to be able to track what their kids do, we provide a Kitabu for Parents app that links to the school management system, but also to the students app, so a parent can be able to see and monitor not just what the student is doing on their device, but what the school, in terms of notifications, school fees, transportation, all of that is doing real time. You can find those on the Play Store, but your school has to be registered and has to have the school management system in its institution for you to be able to take advantage of these 2 tools. But let's talk about COVID. The reason we're here is because COVID-19 has really decimated the learning infrastructure around the world. And some of the challenges schools are facing, schools are closed, they don't have money, they have no opportunities and availability and expertise on online learning. Students are at home, parents don't know what to do with their kids. I'm one of those parents, my 2 children are here. And every time I'm trying to figure out what to do with them, even if I've been in education technology for many years, and they're going to be home for the next 5 months. Teachers, same story. Many have lost their livelihood, and some are even starting to get into, now that we know tutoring has been legalized for the next couple of months, into that industry. So the kids who have been in school for the last 5 or 6 months don't lose out on what they've learned now that schools are closed. And parents who also, have a profession, are trying to watch over their children, be the best that they can be, but not necessarily have, the technology or the internet or the know-how to teach kids. What do we do with these 14 million children who are at home for the next 5 months? And parents who are not very well skilled at what to do, and teachers who cannot reach out. So Kitabu decided early on in March that we're going to do a lot of work specifically in this area. We did 3 main things. We gave out our school management system to schools for free. In fact, one of the reasons why in this group is because we want to do this for as many schools as possible. So the school management system will be free for all Kenyan schools through the end of 2020 and even some of 2021 as they try to get themselves back on the ground. Now, this is going to go with our online support system. We're supporting online learning on our platforms, as I mentioned earlier. And we're also giving free training to teachers on that platform. So if teachers need to learn how to, whether it's manage a blended class or use online tools like Zoom, Microsoft Teams, Gumzo, or the like, we're providing those services for them. Second thing we're doing is Kitabu Class. And Kitabu Class is, I will explain in more detail as we go, 4,500 videos we are creating that are, built along the curriculum that we've had, both CBC and 844, to provide to our students for free. So they just keep reading and learning and reminding themselves what's going on and what happened in school. We don't want them to get into school in January 2021 and they have no idea what's going on. We're also providing an online tutoring and fun learning website where kids can be able to access all this material. I'll show you that as we go. And we're providing open resources for parents, for teachers, and for young children so we can have learn, create, play as something they can be able to do at home. And for parents, we're supporting with homeschooling resources. We're making sure we engage with your children as best as we can. And we're trying to reduce the financial impact of this by providing everything we have in our disposal for free over the next 5 months. So if it's something you want to do with your 7-year-old, your 10-year-old, your 5-year-old, your 15-year-old, we can get you the best stuff we can find from not just Kenya, but around the world that you can be able to get on our websites. So here's a sample of what we have created.
Hello, friends.
Something happened to my connection right there. There it is.
In this lesson, we are going to explore whole numbers. And in particular, we are going to discuss the place value of whole numbers.
Those are the basic ones. This is for younger kids. We have 1,000 videos just like this created by people like Sharon and another bunch of content creators. Some of them you may know, some of them you may not. But in totality, we have 24 content creators. We have 13 who are special needs creators, mostly for the deaf and sound impaired. We have 17 teachers who are helping us go through all this content. And so far we have 1,102 of our 4,500 videos. They're all pretty short. They're not like 25 minutes long. They're 5 to 7 minutes long, and they focus on a piece of content. So for example, if it's a periodic table, picks one element like boron and talks about that. Or if it's whole numbers, it talks about whole numbers. And it stretches from children who are 3 years old to teens who are in high school. Finally, so our ask is about 25 million shillings, actually 25 million shillings, because what we want to do is be able to reach out to 160 more schools in July, do 308, do 675, and keep going so that we can keep vamping up our videos that are being put out, especially the video sets that we're talking about for SNE students. We have a lot of videos we have created for able bodies, but then SNE students are really challenged. So special needs education is something we're very keen on. And then we've kindly reached 3,750 households. You can multiply that by between 3 and 6 just to know how many homes we've reached. Our goal is to reach 378,000, which is roughly 7 or 8 million people with the content we have. And this is the team. We're very happy to be all Kenyan. All of us have been putting our efforts in this for the last 5 or 6 years. I'm the oldest in the team at 40, but everybody else averages out at 27 to 34. And it's a pretty decent team of people. This is just part of the team. We're currently about 14 full-time, and the numbers I showed you previously for those who are working part-time. Please visit our website. Kitabu.Africa is where you find most of what I've shown you. Part of this presentation is also going to be there. But also coming up, thanks to Yafesi Musoke, you might know him from BYSS, is funlearning.kitabu.Africa is something that Yafesi is doing with us, where we're going to be presenting fun learning content for you to be able to learn through as you go. And these are our contact details. If you have any questions, concerns, SMSs, calls, this is where you can reach us. We're very, very happy to get in touch and help in any way we can. Thank you so much, everyone.
Thank you, Tony, for the great presentation and making content look nice. I might even wish when I was in school, we had this and not more kids sing as I age myself. Thank you so much. And tons of great resources. I think even for those who are still on, if you know people who are looking for content, other parents, and especially I think I like that you're focusing on SNE. There have been a couple of questions on chat on people who are working on solutions for the disabled, needs impaired, etc. So hopefully we'll get to see more similar solutions like yours. The final one, education, also revision on Dawati, if the Dawati folks can get ready to present. This one is quite narrow, targeted on KCSE, so I'll let the team take over from here. Dawati, over to you. Hi Nahid, I see you coming up.
Good afternoon, can you hear me?
We can hear you. It would be great to see you as well, if you can turn on your video.
Yeah, just a second, I'm doing that right now.
Okay, and just so you get ready, the Startup Suite team you'll be presenting next after Dawati. Hi Nahid, we can see you. Did you need to share your screen as well? Or you,
Yeah, can you not see my screen?
No.
I did share it, hang on.
Okay, yeah, there we go. Yeah, and just maybe maximize so that we don't see your notes. Yeah.
Is that right? Yeah. Yeah. Okay. Thanks. So good afternoon. Welcome to this presentation on the Dawata e-learning platform. My name is Nahid. I'm the project director and a partner for the project, which was incepted by Carroll Technologies in 2018. The vision is for us to position ourselves as the go-to e-learning platform for specific and impactful Kenyan educational content. We essentially create the content with individual and corporate partners on a revenue share basis and provide that content at an affordable price to all social economic levels. Today, our focus is, however, on KCSE. We selected this particular area because there's indeed a compelling problem to be solved. There's a demand for a solution, and of course, the capacity for technology to solve that problem. With over 80% of this 600 or so thousand students who sit the exam every year failing to attain the pass mark, and with parents certainly seeking out supplementary teaching material, we established that there was indeed a gap that we could explore. We did a survey in 2019 and established that 84% of parents do indeed seek out supplementary teaching, but due to affordability are unable to execute on that. What we found is that parents earning as low as 23,000 shillings a month are willing to seek out an affordable supplementary teaching solution for our secondary school students. Which brings us to our design. Our design is based on a couple of goals. One is, of course, to be affordable at all social economic levels, to be accessible on the web and on mobile devices, online or in offline mode, to be available on demand in bite-sized sort of subtopic content, to provide self-assessments that would recommend gap topics for improvement to students, and of course to be top grade and top quality content, which brings us to how we went about creating our content. Essentially, we've partnered with teachers from top secondary schools in the country. We are focused on some of the core subjects for now, 7 subjects to date. We've completed video tutorials, ebooks, science practicals for the STEM subjects. What you can see on your screen are some screenshots of the ebooks, the mobile app, some of the practical videos, and some of the sort of analytics that are provided to the students and also to the parents. And so parents are able to keep track of what their kids are watching and how far they're going with the content. We price ourselves in 3 ways. We have a monthly plan. We charge 200 shillings a month for access to all 7 subjects. We have a quarterly plan, which is at 500 shillings for all subjects and 1,000 shillings for our annual plan. So during the COVID pandemic sort of months, from March, we have seen a lot of traction. 6,000 so students have joined the platform with 900 hours consumed. This was essentially because we provided free access to the platform in initial months. We've gone back to our paid sort of model now, but this is really the numbers overall. Overall, since we started charging out late last year, we've seen about 22,000 students join our platform and about 1,200 hours consumed. What are the major challenges we're facing on our platform? Well, because our platform is multimedia, videos and ebooks, of course, there's a requirement for device and connectivity. And of course, that there's some cost restrictions there. What we've done is we've explored a no-frills tablet pay-as-you-go model, which can work offline. We're also exploring strategic relationships with telecommunication partners. So that's the Dawati device, which we piloted briefly last year. And what are the next steps? The next steps for Dawati essentially to secure $450,000 in funding. We require this funding essentially to fuel our growth in developing content for the remaining subjects in secondary school. We're also looking to develop content in technical and tertiary level space in the secondary and rather tertiary and technical spaces. And we're also looking to, of course, put in place a sort of governance structure at Dawati. We currently don't have a board that's specific for the Dawati product. And so those are some of the next steps we want to pursue. A little bit about our leadership team. Eddie and Mohammed are the founders. Eddie is the CEO of Caro Technologies. Essentially, his role is to provide oversight and resources for us to grow the platform, or has been so far. Mohammed is the CTO, and he essentially oversees the platform development and enhancements. And, my role is essentially to drive a lot of the strategic engagement and much of the operation. And yes, we're also 100% Kenyan, as is our development team and our admin and sales team. So with that, I'll conclude. We do have a very comprehensive business plan, pitch deck, in a financial model. On the screen, you'll see our email addresses. Please feel free to reach out to us. We're located at Sifa Towers along Ring Road, Kilimani. We look forward to hearing back from you.
Thank you. Thank you so much, Nahid, for your presentation, and hopefully you'll be able to get the awareness and partnerships that your team is looking for. We're now over to the last segment, and then it should be done. Thanks everyone for your patience. These are startups focused mostly on the economy more broadly. So we have two that are agri startups and two that are other businesses. I think the first team coming up, if we can get Startup Suite to present, Brian, and then Patrick, Ika Africa, if you can get ready to go after Brian. Thanks.
Thank you very much, Ori, and I hope you can hear me clearly. I'll start presenting.
We can hear you. It would be great to see you.
All right, my video is up as well.
Okay, yeah, there we go. Good.
All right. So thank you very much, ladies and gentlemen, and all the dignitaries, if they still are with us. Thank you very much. So my name is Brian Yargol from Startup Suite. Startup Suite is a product of Brainverse Technologies, and I'll be presenting with Venetia Kakusha. Please confirm if you're watching this. So thank you. So in the wake of COVID-19 pandemic and economic digitalization, many small and medium enterprises are struggling to be able to transition from office teams to remote work from home teams. And the existing solutions they are trying are either a bit more expensive for them to commit to, some of which require up to 2,000 shillings per user per month. Some are too bulky for them to use, and some are only suited for single purpose use and are not built to grow with these startups that are actually starting to grow and or grow in the process of growth. So Startup Suite bridges this gap by centralizing systems to help these businesses maximize their efficiency and enabling them to work with the decentralized remote teams, at the same time harmonizing their business process, and this helps them to create a smooth operation and delightful customer experience. Our solution, which is Startup, provides a platform, a digital platform, software as a service platform that allows any business owner to manage the crucial aspects of the business, starting from staff to customers to products and services to projects and finances in one place under one roof. And for as low as 1,000 shillings per month for up to 10 users, any business can actually spin up Startup Suite in less than 20 minutes and start operating effectively online. Startup Suite adapts seamlessly to any organization, and it also provides a super admin account access, which allows someone to create roles within the organization and assign different permissions on the platform. And this platform contains several modules, from customers to HR module to work module that integrates projects, tasks, and task completion logs, and finance, and a reporting module that allows the business owner to, and even the staff, to have a 360-degree view of what's happening in the organization at any given time.
So Startup Suite's revenue creation is through subscriptions, and it's a subscription economy, and it gives the problem of a nomadic consumer. So hence, customer happiness is at the core of the business. We aim to ensure customer experience and happiness by creating great customer support, and product development informed primarily by customer feedback. We look to grow our revenue to 735,000 Kenya shillings per month within the next 12 months and on board up to 490 companies onto our platform. And to reach this milestone, we have a deficit of around 10 million shillings that we are looking to raise in this venture. The partnerships we look to be able to have customer acquisition is with innovation hubs, SME bodies in Kenya, direct marketing, customer references, and to create network effects within our ecosystem that will spiral us into having 490 companies or more within the next 12 months. Our team comprises of Brian Nyagol, who's a CEO and who has experience in the technological space with tech leadership over 6 years, and he's a senior software engineer. We have Dennis, who is a product developer and has 1.5 experience in mobile apps development. And we have Venetia, who is basically the voice of the customer and has experience in customer care, marketing, and product development. To contact us, you can contact us through web or email on hi@startupsuite.app or www.startupsuite.app, or contact us through the phone numbers that we have placed there. Thank you very much for your time.
Thank you very much.
Thanks, team. I know, like a mother who's not supposed to have favorite children, I should not declare any favoritism, but I really like what this team is doing. As you can see, they're young and they're working on solutions that are affordable to the SMEs, and their asks are actually, hopefully they should be able to get the support that they need for traction. And yeah, thanks for a great presentation.
Thank you.
Over to Patrick. Patrick, I could see you, but you're on mute, maybe.
Can you hear me now?
Yep, we can hear you.
Right.
There we go. We can hear you and see you. Please go ahead.
Thank you. So good afternoon, everybody. My name is Patrick Sampao. I am engaged at ECA Africa. ECA Africa is an acronym for Agriculture and Climate Risk Enterprise. We exist to serve the smallholder farmers and stakeholders that work with smallholder farmers, and we exist to provide risk mitigation solutions in agri-finance especially. This means we provide crop insurance, affordable crop insurance products for farmers, and ensure small loans or MFI loans offered to farmers. Now, what we have today is a solution that comes to mitigate challenges that have been associated or farmers have experienced since the emergence of COVID. Now, when COVID happened, a couple of things happened to smallholder farmers. Number one, the access to inputs, quality inputs, was hampered. And this is because of increased transport costs, cessation of movement, and other challenges. Now, what happens when farmers don't have quality inputs, the enterprise is basically dead on arrival as they cannot plant good seeds, which give good yields. Then what also happened was markets. This means farmers cannot sell their products. It also means that people or the public who come to buy the products from farmers cannot come to the markets, and therefore it means farmers cannot have the farmers have been denied income that they can use or should be using to purchase inputs for the following season or even the current season. And lastly, there's been limited access to finance. Microfinance institutions are currently not lending to farmers. And even when they are, the thresholds of lending, thresholds of credit scoring are too high for majority of farmers. Now, the impact of this is that about 80% of the population will experience or is experiencing food shortage, mostly because that same population relies on smallholder farmers. So we'd like to establish a platform that helps these farmers to access inputs affordably. Now, what we have is a solution. We seek to establish a solution that helps farmers to save for hybrid seeds by making small deposits, small amounts into their mobile money wallet accounts. Now, what will happen is these farmers will access the product through a scratch card, and you will see it shortly. They will then scratch it. It basically operates the same way airtime scratch cards operate. What we've done is plug in or integrate USSD and M-Pesa platform. So a farmer will dial *800*. They will then be led into an M-Pesa checkout system where they will enter the amount, then their PIN, and the money will move, of course, from their wallets to our wallets. They will then save subsequently via mobile money, of course, to the end of, to the beginning of the season, or the upcoming season. What will then happen is they will go to the agro dealer shop where they will have received a voucher from us of the amount they saved and the quantity of seeds or inputs they have saved for. The agro dealer will validate the code, again, using a small, using a feature phone, They will then, of course, give them the seeds to take home. Now, what you see is a card, is a sample of a card. And as I said, the card is our entry product or our onboarding tool that farmers are going to be using to activate their first saving amount. And as you can see, the farmer can save from as low as 50 shillings for the initial savings. Something to note is that we are working with various brand or varieties of seeds. We have Seedco, we have Kenya Seed, we have various other manufacturers of seeds. So it means the cards are going to be branded with the variety that the farmers prefer. If you go to Western Kenya, Western Seed is popular. If you go to Eastern Kenya, Seedco is popular. You go to parts of Rift Valley, Kenya Seed is popular. So we're going to have a product for all these farmers. Now, our team is vastly experienced in agri-finance. We have our CEO, George Courier, has been a CEO in various insurance companies in Kenya. Myself, Patrick, I have about 8 years of experience in product design and route to market design. We have Joseph Chege, who is an agronomist and will play a key role in identifying the good quality inputs. And then we have Mutiti Kinyanjui, who has vast experience in business modeling. Now, what do we need to carry on with our solution? Number one is to recruit and train agro dealer shops. As I said, agro dealer shops are our points of redemption. This is where farmers will go at the start of the season after saving to redeem their inputs. Then we need to establish a network of agents in the rural areas. And this is because USSD and mobile money are not so obvious. It's a new solution. Plugging in USSD and M-Pesa is new to very many Kenyans in rural areas. Therefore, they need a lot of hand holding. Then of course, we need to enhance our platform to accommodate input saving, mostly because our current platform is built for agri insurance, so we need to adapt it to accommodate input savings. Now, the output of this will be, we're going to have multiple agro dealer shops. The more, the better. It means the more agro dealer shops that will accept redeem these inputs, the better for farmers. It means we can spread wide. Then, of course, we're going to have more farmers who are aware of the product, and they also know how to access it. We are located in Nairobi, headquartered in Nairobi at Zepri Place in Upper Hill. My number is there, my email is there. For further questions, we can talk on the chat. Thank you so much.
Thank you, Patrick, for that presentation. And yeah, in case of any questions, please ask on chat. I know there's some people watching on YouTube. We're trying to figure out and asking questions there. We're trying to figure out how to respond to those questions as well. So hopefully either we'll share them with the entrepreneurs here or ask them to check out the link afterwards and respond there. We're almost there. I think, I don't know if the portable ventilator, are you back in?
Yes, I am.
Anthony? Okay, great. If you could please go ahead, Anthony.
Hi, can you hear me?
We can hear you. And I don't know whether, do you want to turn on your video as well, or are you not able to? So we can see you. I think I should be able to do.
Looks like I can be, okay, can you hear me? You can see me now?
Yeah, we should be able to see you shortly, so please go ahead, but we can hear you. Please go ahead.
Hi everyone, my name is Anthony Mudungu. I'm the CEO and founder of Totsai Limited, and I'm very pleased to introduce to you the Volt Toto ventilator, a compact, portable, and reliable ventilator meant for home-based patients for COVID-19. This machine is most critical as it helps COVID-19 patients with respiratory or breathing problems. This is the ventilator, and because of its compact nature, it can be used as a first aid measure for patients with breathing problems who are also home-based, and it can also be easily installed in ambulances, homes, schools, small clinics, factories, offices, etc. The ventilator is easy to operate. All one needs is to plug and play. We are pleased to inform you that the ventilator has been tested both at Kenyatta National Hospital, Aga Khan, and Kildi and KEBS plus KP. This idea and the innovation has already been patented. The response was overwhelming as it was described as a compact, efficient, reliable, and affordable. A major point was easy of setup, which would make it very usable in emergency and home-based care unit. Because of its affordability, portability, and ease of use, and being a compact unit, it can be made available in every ambulance, clinic, and other health facilities which are being equipped to fight corona. And the corona pandemic that has hit the world offers a very unique opportunity for the ventilator, as this unit is very critical as part of emergency equipment necessary to fight COVID-19. We are seeking financial assistance of 10 million shillings to be able now to develop this product further, and also have this ventilator developed and also subjected now to health standards so that we can be able now to roll it up for use. This ventilator has been patented already. And I'm pleased to introduce now the team behind this ventilator. That's me, Anthony Mudongo. I'm the founder and CEO of Totsai Limited, a graduate of Karatina University with a diploma in computer engineering from ZTech University. Been in innovation for the past 13 years. And also I ran my own startup that manufactures USB cables locally. I've been awarded locally and internationally. Top among locally include top 40 under 40 years men, Kenya, top 100 Kenyans 2019, and among other face of Kenyan science 2018. My strength is building business and ideas from idea to revenue generation stage, as well as building IoT devices. We also have my colleague, Peter Bilia. He's also a graduate of Technical University of Kenya with a diploma in electronics and electronic engineering. He has also been in innovation for the past 11 years as he's also an entrepreneur who ran his startup called Talent that built IoT devices. He's also a fellow of Africa Prize 2017 in UK, and he's also staying his building business and IoT devices. We hope the government will find this project worth the support. Thank you.
Thank you so much, Anthony, for that and for being very quick and efficient. I can tell you're an engineer. If there are any questions for Anthony, sorry, I didn't realize there were issues with the chat, but I think they're now fixed. So people who might have had questions earlier, please repost them. I understand that we're not going through. And then I'll hand over to you, Steve, with Zalisha. Please go ahead, Steve.
Hi everyone, my name is Combo Steve. I'm the director and founder of Zalisha. Zalisha is a smart farming platform that enables farmers to access information, precision farming, record keeping, and financial services through their mobile phones. So first and forward, what is the farmer problem in Kenya? Farmers in Kenya lack access to quality and modern farming information. As we know, farming is the core or the backbone of the Kenyan economy. It employs majority of the population in our country. So despite challenges coming up, most of the people, even when they retire, they go back to farming. But farming has not been profitable to the small-scale farming. So these challenges, such as lack of information, access to certified quality farm inputs, lack of reliable marketplace, and lack of access to financial services have made most of our farmers to remain poor. So what solution are we really providing? We're offering farmers a digital platform through their mobile phones that they can be able to access information, access markets, access financial services, and do record keeping through their mobile phones. So how do we work? We work with small-scale farmers, and we also work with people or companies working in the value chain. For instance, a farmer can be able to register for free through our platform. We don't charge farmers, so farmers download our platform. The farmers can be able to do record keeping on our platform. So a farmer can be able to geolocate their farm depending on where it is located. And now a farmer can be able to get access to information such as weather information, and they can be able to be guided from planting to harvesting. And then the farmer can have access to a marketplace that is actually free for the farmers to post, where farmers can be able to access or share their farm or post their farm produce. And at the same time, farmers can be able to access quality farm inputs. And then we have also included an aspect where farmers now can be able to be credit scored so as to be able to access finance. So for farmer cooperatives and companies dealing with the agriculture value chain, we offer them a platform where they can be able to manage their farmers, enable communications. We noticed that in Kenya, crops such as coffee, tea, which are the main exports of this country, are not profitable to the farmers who do the hard work. You find brokers or even companies that are not based in Kenya, the ones that benefit more. So we want to provide this solution to be able to enable the small scale farmers, the farmer cooperatives, to be able to access, to use our solution to be able to access better pays and to be able to access better markets. So coming to our team, I am the director and I have my teammates. There's Martin Kamau, who's also co-founder, Ian Chedwete is a co-founder, and there's also Mercy, who's also a co-founder, and she does finance, and the others were in IT. So we have partnered with various other institutions such as KEFIS, there's AFSI Foundation, Sukafina, Kenyatta University, and some of the other institutions where we provide farmers with access to real-time information, quality information, and we are going forward to provide this solution to be able to help the small scale farmers to be able to access finance and to be able to access other services through our platform. So I'll ask, we're actually looking for additional funds to be able to do customer acquisitions, access, also expand our market. And we're also looking for mutual partnership with other government institutions and other interested stakeholders in the agriculture industry. So our website is zalishafrica.com, and we are located at the Chandaria Business Incubation Center, Kenyatta University. So if you are a farmer or you want to practice farming, you can feel free to join our digital platform and you can be able to enjoy the benefits of farming. Thank you, and hope this will help most of our farmers gain more income as we battle these challenges that brought by COVID-19. Thank you.
Thank you so much, Steve, for the presentation. And now, last but not least, George on Aaron's guys, and then we'll wrap it up just with some next steps from me. Over to you, George. I had turned off your video, but you can turn it on now.
Okay. It's disabled from your end, I think. Thank you for this opportunity. My name is George Kishuhi, the CEO of ErrandsGuy. ErrandsGuy is an e-commerce platform that seeks to connect individuals that need help with their day-to-day errands challenges with individuals who have the skills, the time, and are willing and ready to make money out of running errands for other people. And basically what ErrandsGuy targets to accomplish is offer convenience and reliability to individuals, for example, who have limited time to run their day-to-day errands, for SMEs and startups who have challenges or limited resources to be able to run their errands efficiently. And also we have Kenyans living and working in the diaspora that have limited distance challenges that they are unable to carry their errands locally. So via ErrandsGuy, they can be able to have their errands sorted while they are far away. We are also targeting corporates where we offer them an errands package targeting their employees such that their employees can focus on running their core duty while we run their errands, thus ensuring that they remain productive and efficient while also working with a peace of mind. And through this and using our platform at ErrandsGuy, we are able to offer dignified jobs to young people who have skills and are in need of jobs. And currently also during COVID-19 period, a lot of people have been losing jobs. And through this platform, we've been able to have an impact in their lives through offering opportunities for such. And through this, they are able now to have some daily bread for their day-to-day lives. And through the ErrandsGuy platform, which my co-founder will be able to share something a little bit on the same. So Neville Karibu.
Hello everyone, my name is Neville and I'm the CTO at ErrandsGuy. Now ErrandsGuy is a platform that was built with scale and convenience in mind. We'd like to serve every Kenyan across the country, that is all the 47 counties. We recognize that there are different demographic differences that are there across the country. And for example, you'll find that the senior citizens would like simple technologies that are intuitive and simple to use. People in the rural areas and the urban middle class, as well as the lower classes, want technologies that work well with cheap feature phones and the other devices that they're able to afford. The ErrandsGuy platform has built prompts and prompts a user to install the Light PWA app at the on instance whenever they are joining the app, whenever they visit our site. And this app is only able to take a few kilobytes from your mobile phone or any other web-enabled device. We also have Android and iOS versions that are coming up, and they'll be available within the app stores very soon. Some of the services, such as the shopping and delivery services, have been very featured, and some of our customers are enjoying very much. They are very simple to use, and our smart location finder, this is what we use for our shopping and delivery services. They're able to actually find your location in a very smart way. All you need to provide is the landmark and the road or the street that is nearest to your landmark location, or where you want your goods to be picked or delivered, and it will return to you the results that are finding the best guess of your results back to you on the screen, and you're able to get an estimate of the pricing for that. Then we also have a chatbot on our system that it allows us to interface with the customer and be able to help them so that they can access our services in an easier way. Our biggest competitive advantage is our quality of service, and this can be seen when we look at the testimonials. Even though everyone can sign up to be a fulfiller on our platform, we have a very strict selection process, and this kind of selection process allows us to offer the best quality of service to our customers. Once a visitor visits the ErrandsGuy platform, they'll be able to view our range of services, and they can be able to post their orders, and once we receive them, we're able to provide the services. If anyone did not find a package that suits their needs, they can fill a custom form order that we will receive, and then we are able to call them back and get a proper description of what they need, and we're able to service their needs. Our platform is very simple to use, and caters for multi-generational as well as multi-economic capabilities of the different people across the nation. So I'll return it back to George so that we can talk about maybe our asks. Thank you. Over to you, George.
During the impact or this year, we've been faced by a challenge, and that is in COVID-19. And in every dark cloud, people say that there's a silver lining in it. And for us at Terran Sky, the silver lining in this period is that despite wanting to so much do business, we've also been looking at how we can impact communities. And through the support and partnerships established with various organizations like Nyamamama, Juliani, we've been able to deliver personal protective equipments and also be able to distribute food for organizations, such that an organization only needs to think about what they are willing to donate to a certain community. The work of going on the ground, the distribution and the footwork is run by Terran Sky, so that also we can be able to support while also ensuring that we are adhering to the Ministry of Health guidelines that are laid in place. Like for example, when our people are serving clients while they are at home, we ensure that they are well protected, they keep safe distances. And also in these, we've been also working with corporate bodies, encouraging them to consider using our services for their corporate social responsibility, such that even as we continue countering the challenges of COVID-19, we are also spreading humanity in the same and also creating opportunities. Because during this COVID-19, a lot of people have been working at home. Ours is to support them to continue being productive and being more efficient using our platform and using the team that we work with, such that there are people that are able to earn, but apart from earning, there are also those people that are supposed to continue with their way of life, even despite the challenges of COVID-19. And through this, we are able to work with a very good team that we've put in place. And through this team, we are able to plan and efficiently implement the various goals that we have in achieving our desired goals and impact in Kenya. We can be found in Nakuru, Nairobi, we are in Coast and in Vihiga County. Our contacts are at the last slide, but above all, for us to be able to be very effective, we have an ask where we are seeking help for financial resources amounting to 5 million Kenya shillings, which will help us in scaling our impact and also creating a lot of awareness about the platform. Because since we started, we've been bootstrapping, but we believe with an injection of some financial resources, we shall be able to even scale further and have more people benefit from this platform. But notwithstanding that, we always seek for opportunities. And I believe through the platform or this webinar, we have a lot of entities, the private sector, we have government bodies represented here, and individuals who run startups and SMEs that we would wish to support. So in your day-to-day engagements, consider Terran Sky to run your errands, both skilled errands and unskilled errands. Thank you so much as we look forward even to doing better and better in the days to come. Thank you.
Thank you so much, George, for your presentation. I see some questions on chat. You might want to respond there. And with that, I think we have come to the end of this webinar. It was a learning process, and so hopefully the rest will be, we can keep to time and figure out, I think, juggling between giving everyone opportunities versus making sure that we're keeping to time. And I think we did all right overall. We're 7 minutes of a schedule. Just in terms of next steps, I think first of all, a big thank you to the CA Secretariat, but to Mercy Tepler in particular, who was chasing all of these decks and presentations and dealing with me, calling her every 5 minutes to work on one thing or another. We pulled this together in a very short period of time. There were quite a number of teething problems, but we made it, and hopefully we'll keep getting better as we go. But a huge, huge thank you to Mercy in particular. I want to call her out, and to the rest of the Secretariat. Also would like to say thank you to all the innovators / entrepreneurs who have presented. It's not easy when you're working on your day-to-day to find time to prepare, but she did. And you took my feedback when we did the demos on Thursday, and I'm really happy to see very nice focused decks from all of you. So thank you so much for all your hard work, and I hope this pays off in one way or another. Finally, I think thank you also to the members of the committee who've been spending a lot of time reviewing all of these submissions. And there's some, even though we're not showcasing here, that we're trying to help one way or another, either through policy recommendations, helping link them to the right government agencies. And so this is not the full spectrum of everyone who we're engaging with, but just a snippet, I think, of some of the interesting ideas that we've seen. Really heartened to see the just local teams, really interesting solutions. And again, I hope through this visibility that other partners can step in. In terms of next steps, I think we are going to work on a landing page on the CA's website, where we'll upload all these decks in case you want to follow up, so that you have everyone's contact information. I think I've shared on the chat, there's still a call, another call for submissions. I think we have about 2 more weeks to go if you want to submit your ideas, for those of you who've not participated yet. And if there's anything else we could be doing, there's a lot, very limited time. We can only do so much. I think this is really to open it up for others, whether it's the media who are here and you can highlight some of these ideas, whether the funders. I think we're definitely making sure the government is listening on the policy front. But if there's anything else that you think we could be doing, please do reach out to us as the committee. And with that, thank you. I release you all to catch up with what the president has told us today. And thank you again for your participation. Goodbye, everyone.